Welcome to this meeting of Dundee City Council, which is being held remotely in terms of Section 43 of the Local Governance in Scotland Act 2003. All members in attendance are able to fully participate in the meeting, which is being recorded. Should any member need to leave the meeting for any reason, can they please use the chat to advise of this? If a member loses their connection, they should make every effort to rejoin the meeting, but if this is not possible, the Committee Services Officer will note their absence for the remainder of the meeting. If you have to leave the meeting due to a declaration of interest, you must remain out of the meeting until invited back in. Would all members please mute their microphones when not speaking to avoid background noise and turn off any smart speakers. Please start the meeting with your camera on. Your face will appear on the screen when you are speaking. If your connection is poor, you may wish to turn off your camera and see if this improves matters. If this doesn't help, you may wish to quickly leave the meeting and rejoin. If you wish to raise a point of order, ask a question, speak on any item or move a motion or amendment, please use the chat when the relevant item is called. The convener will then invite you to speak. Would members of the press and public please not post messages in the chat? Where items are for noting, or where there has been no disagreement expressed, the convener will call for any member who has a contrary view to indicate this through the chat, otherwise the item will be agreed. Please would members not use the chat for any other purposes, as those joining the meeting by telephone cannot see the chat and therefore will not be able to follow the debate. Although we are operating in a different way, this is still a formal meeting of the committee and the council, and the required standards of behaviour and discussion are the same as in a face-to-face meeting. Standing orders will apply to the proceedings, and the terms of the Councillors' Code of Conduct will also apply in the normal way. Does any member have any queries regarding this procedure? There are no queries, Lord Provost, so I will now ask the Committee Services Officer to take a roll call for the minute. Thank you.
Thank you. Lord Provost.
Present.
Councillor Alexander.
I'm here.
Depute Lord Provost Campbell.
Present.
Councillor Cordell.
Present.
Councillor Dawson.
I'm here.
Councillor Flynn.
Good evening, present.
Councillor Hunter.
Present.
Councillor Lynn.
Present.
Councillor Rendell.
Evening, I'm here.
Bailey Roberts.
Good evening, I'm here.
Councillor Rome.
Good evening, present.
Bailey Sawyers.
Yes, I'm here.
Councillor Short.
Here.
Councillor Smith.
I'm here.
Bailey Keenan.
Present.
Councillor Cruikshank.
Present.
Councillor Macready.
Present.
Councillor McIrvin.
Present.
Councillor Malone.
I'm here.
Councillor Mara.
I'm here.
Councillor Richardson.
Present.
Bailey Wright.
Present.
Bailey Scott.
Here.
Councillor Hay. Councillor Hay. I'll mark him as absent at the moment. Councillor Scott.
I'm here.
Thank you. Bailey McPherson.
Good evening, present.
Councillor Duncan.
Here.
Councillor Murray.
I'm here.
And Councillor Ross.
I'm here.
Thank you. That concludes the roll call.
Lord Provost, members of the Council, there is one item of business for the City Council this evening, the minutes for information and record purposes.
It is agreed.
Thank you, Lord Provost. That concludes the business of the City Council. Would you please remain in the chair for the meeting of the City Council as Fleming trustees? Thank you.
Thank you. The first item on the agenda is declarations of interest. Does any member wish to declare an interest in either of the items on the agenda? I'm not seeing any indications, so that takes us on to item 2, registration of Fleming Trust with Oscar. Your instructions are requested regarding registration of the trust with Oscar.
Mr. Manny.
Thank you, Lord Provost. As the Committee Services Officer has indicated, the Council's instructions are requested. You will see from the note that the officers are recommending that the Council proceed with registration.
Is that agreed?
Agreed.
Thank you. That takes us on to item 3, Fleming Trust increasing supply of affordable housing. You are asked to approve the report.
Is that agreed? Is the report agreed?
Agreed.
Agreed.
Right, thank you.
Thank you, Lord Provost. That concludes the business of the City Council as Fleming trustees. The next committee is the Children and Family Services Committee.
Good evening. Welcome to Children and Families. Willie, can we just start with the business, please?
Thanks very much, Convener. Firstly, I can advise the committee that there are no external members present at this time. It takes you on to declarations of interest. It's where not any of the members have any declarations to the content of the agenda as it stands. Okay, I note that there are no declarations. Yeah, thank you very much, Convener. I'd just like to advise that there being no external members present, it takes you on to item 2, which is the Dundee Child Protection Committee Annual Report, which is for noting.
Okay, so first of all, welcome Elaine Torres, who is the independent chair to the committee. Councillor Cruikshank, I noticed that you've got indicated you want to ask a question. What I'm going to do is I'm going to ask Elaine just to speak first, and then I'll open up to questions after that, but I'll come to you after that. But Elaine, if you want to, I'll let you introduce your report.
Okay, thank you very much for the opportunity to speak to this report. This is the Independent Chair's report, and it covers the period August 2020 to July 2021. So we aligned this to the school year, if you remember, those of you that remember a couple of years ago. So child protection committees have the overall strategic responsibility for continuous improvement of child protection policy and practice. And in my role, I'm kind of in a unique position, I guess, to see right across all the agencies and individuals who work on that committee, and able to hold people to account and ask the awkward questions, I guess, in my role as an independent chair. The report covers areas of improvement over the year, and I just wanted to highlight a few of those just to get the report, so you can see the detail in the report. But there's a clear focus the committee has adopted on managing strategic risks. And as well, during this period, we had a child protection inspection, and the committee led, the leadership of the committee led that approach, supported very ably by the public protection team. We have focused on data a lot more, but not just the presentation of data, but analysing data and asking scrutiny questions if that data was indicating something that we wish more information on, to delve in a bit more detail. And that's really improved over this last year, with everybody participating in that and taking a real active approach to that. And you can see some of the data in the report, which I'm not going to go through because it's there in detail for you. We've also focused on assurance processes. We've received reports on the operation, for example, of the multi-agency screening hub, and that's important because the committee has an assurance role. It needs to make sure that the child protection policies and procedures are working effectively. So we've been receiving regular reports to assure ourselves of that. We've had a number of case reviews this last year during this period, and we did establish a case review group to oversee the learning activity. I'm very keen as the independent chair that any case reviews that are undertaken, the actions are robustly dealt with, that they are implemented, and that actually they make a difference to people's lives, which is really, really important. So that case review group has got an important role to take that forward. We've known that we've had more work to do around engaging young people in our work, and particularly how we hear the voice of young people in the committee. And we've established an engagement subgroup to plan and take forward improvements in the way children and young people inform the work of the committee, and also that we hear their voice and we get the data, qualitative data about how they feel they've been protected and how they feel they're safe through this period. And of course, this period covers the pandemic, and the committee met much more regularly during that period to oversee partnership working, identify any risks, but more importantly, to look at mitigating actions that reinforced the fact that young people and children were safe during that period. That was a real concern, that when schools were off and they weren't being seen regularly, that there could be a risk of greater harm occurring. So we're very keen to make sure that that happened. And I would just like to say that I really was impressed by effective partnership working during that period. Everybody pulled together really, really well. And particularly, I think praise has to go to the staff, who have to be commended for their dedication, their flexibility and their commitment during that period. And I think they've been really part of the response during that time to make sure that children and young people were seen very regularly. The inspection report wasn't published until January of this year, but it does look at services during this period, and I was very pleased to see a number of strengths identified, particularly referring to effective leadership and collaborative working between partners, were being very much commended during that report. But we know we've work to do. The Care Inspector identified a number of areas for further improvement, so you can see those at the end of the report. We have more to do around improving responses to older young people at risk of harm, that late teenager group, and they're the ones that often cut across adult protection and child protection as well. So we've more work to do to make sure that we have the appropriate services in place and that they're supported and safe. We know we've got to enhance our quality assurance processes. I talked before about new quality assurance reports coming through, but we'd like those to be multi-agency and have a clear plan of that for the year. I've talked before about involvement of children and young people and families, hearing their voice, very important in this coming year, and cross-cutting work with other committees. We're noticing that particularly older young people who have complex challenges to drug and alcohol, often domestic abuse happening around them. They're ones where we need to look across all the committees and work together. And I think at the Chief Officers Group, that's been very much promoted. So I hope this report gives you a good flavour of some of the issues in the report, and I'm sure myself and the officers are happy to answer any questions, Councillor Hunter.
Thank you very much, Elaine. It's very much appreciated. So as indicated earlier, Councillor Cruikshank, I think you were the first to indicate that you had a question, so I'll pass it over to yourself.
Thanks very much, Convener. I hope you'll indulge me. I've got a bit of a preamble and 4 questions to ask. Firstly, I want to acknowledge and pay tribute to all those staff working in our child protection services. Their hard work is to be commended, especially with the immense difficulties of the past 2 years. The people on the ground do their very best every day, so it's important that they have our support. With COVID-19 lockdowns forcing families into much closer quarters than ever before, charities such as the NSPCC found that this increased the stress on parents and carers, the vulnerability of young people, and isolation from other people and protective services. Whilst there was a clear public health risk to be dealt with, these charities have found that there was an increase in the risk to children's safety and well-being. We've all heard the phrase behind closed doors. I'm therefore encouraged to see the committee's report has taken COVID into consideration throughout the report. Of course, we now hopefully find ourselves putting the worst of the pandemic behind us, and I see that the report has lots of ideas for improvements in general. But I'm curious as to which of the report's recommendations will specifically focus on any future public health emergency of children included on the register last year were unborn babies, compared to a national average of just 4%. What is the committee's understanding of this, and why is it so high in Dundee, and what targeted actions are being taken to reduce it? Also note that over the course of COVID, Dundee has not seen the same percentage in referral numbers as the rest of the country. But can you tell us how Dundee's starting point compared to elsewhere? And a graph on page 17 shows that even with an improving picture, Dundee still requires more child protection orders than other local authorities, especially where mental health is concerned. This was also identified as a weakness by the joint inspection. So even with established relationships to mental health services, the rising trend surely suggests that those services are lacking in the resources that are necessary to get this important issue under control. And finally, it's good to see that the report that our staff have been able to sustain such a high level of contact with children and young people during the pandemic. As we move through the recovery period, are we continuing with the good practice? In section 4.6, the report refers to the committee developing its improvement delivery plan. Can you tell us a bit more about when this plan will be finalised and implemented? Thanks for bearing with me.
No, that's absolutely fine. This is a really important subject, so I'm more than happy to do that. I'll pass to Elaine first, and if there's anything that officers can answer as well, we'll do that. But Elaine, I'll let you go first.
Okay, thank you. I'll answer some general questions and perhaps ask some of the officers to comment more on the detailed data that you've highlighted there, Councillor Cruikshank. I think one of the learning points for us was around, how we can, through the pandemic, make sure that we see young people, especially when schools were off, which I mentioned before. And I think one of the real benefits of that in Dundee was our ability to pull together a hidden harm group, which brought all the agencies together and really looked at any children or young people that weren't being seen, that there was concern about. And some of the data in that illustrates that we were one of the highest areas in Scotland who were able to see young people and children during that period. So I think that was very, very positive, actually, in terms of ensuring ourselves that we were seeing children, we were hearing them, and any concerns were being picked up. And that's a credit to all the officers that responded to that. And certainly at committee level, we looked at that and made sure that that was happening, and the data helped us to inform about that. So that was a really important point for us. And I think a lot of the digital things that have happened during the pandemic, I think, should stand us in good stead if this happens again. Hopefully it doesn't, but I think there's been a lot of learning that we have been taking forward to help us with that. So there's a couple of responses there to some of the general responses. I'm not sure whether if Glyn Lloyd's on the call, Glyn could want to comment on some of the more the data questions, and particularly around the unborn babies. Is Glyn with us?
Yeah, thank you, Councillor Cruikshank, and thank you for the kind words about the partnership in general, and actually, obviously within that, all the social work teams as well. In relation to unborn babies, there are a higher proportion in Dundee that are on the child protection than elsewhere across Scotland. We think that's partly due to the demographics of the city, in the sense that a high proportion of parents or carers of substance misuse, mental health, domestic abuse, or other problem, and in fact, in some cases, all of those problems at the same time, interwoven. And partly, because, as the inspection report says, we're good at early identification and assessment and have a range of partnership projects in place to provide effective responses to those identifications and assessment. So in relation, for instance, to unborn babies, you're aware we have the Pause initiative supporting women who obviously don't have children in their care but are at risk of having children in their care, and those children being taken into care. We have the New Beginnings initiative, which is itself a partnership initiative involving health, social work and the third sector. We have the NHS Tayside Family Nurse Partnership supporting young mothers up to age of 25. And obviously we have the social work locality teams as well, supporting a range of parents that fall into that category, either pregnant parents or parents with babies and toddlers. So I think it's partly due to the demographics, it's partly due to the partnership response, and it's partly due to the fact that we're good at assessment and we've got a range of different initiatives to follow up on those assessments. The data on numbers, I think again is right to say that the trends were similar as previously. But again, I think that is because the Dundee Partnership has effective arrangements in place to identify and provide the right type of support at the right time. So what we've done is that those coming through the system where there is an assessed risk of significant harm, is we've supported them through IRD meetings or Child Protection Committee meetings, and they've received social work support where necessary. And those that don't meet those thresholds, where there's not a significant risk of harm, we've coordinated support from elsewhere. And during the pandemic, that type of support has included, for instance, support from the community support centres. So we've referred children into the community support centres if they would have benefited from a place. It's included support in relation to summer play activities as well, and it's included a range of third sector support, including access from the new Fort system, which you've also heard about. So although overall numbers coming into the system have been more or less the same, and although the proportion of those meeting child protection thresholds have also been similar, we're confident that across the system, in terms of the range of services available across the system, families have still had the right support from the right service at the right time.
Sorry, I was just trying to get myself off mute there. Councillor Cruikshank, is that answer your questions, or do you have any follow-ups?
No follow-up. Thanks very much to Glyn and to Vicky for the comprehensive response. Thank you.
Okay, thank you. So the next person I have is Bailey Wright.
Okay, thank you, convener. Obviously, I think it's good to see the at section 4.5.2 of the report, and we have to congratulate the staff that Dundee has been able to sustain such high levels of contact with children and young people during the pandemic. My question on that is, how has this been possible, and is there any feedback from families and from staff about the impact that this has had on them? And I see at section 4.6, the report refers to Child Protection Committee developing its delivery plan, and I would like to know a bit more about how the committee is taking this work forward, and if there's any timescales for finalising the plan. And the last thing is, I noticed on page 17 of the annual report that domestic abuse is the most common concern for children on the Child Protection Register, and that levels are much higher than the Scottish average. And my question on that is, you know, why are levels so much higher, and what are we doing to address this?
Okay, so again, I'll ask Elaine to come in first, and if there's anything that officers can pick up, they'll come in as well. But Elaine, I'll let you go first.
Okay, thank you. And thanks for the question about the delivery plan. Yeah, we have got an outline delivery plan, and we have a development day that's coming up very shortly. What we wish to do is really prioritise the actions in that plan. Obviously, we have the inspection actions that we need to address, but there are other things that we need to move forward with as well. So what we want to do is make sure that we have all our partners behind the delivery plan, that we're clear about the priority actions, and they will be with timescales and who's responsible for them. That work will be completed by April, and we intend to bring that to the Chief Officers Group, so that it isn't going to drift. It will be completed in the next 2 months. So that should hopefully that reassures you on that one. The high levels of contact with children and young people during the pandemic. Dedication of staff, I think, people going out, going the extra mile, you know, knocking on people's doors and going in houses, even with the appropriate PPE. You know, people really stuck to the task and supported children and young people during this period. So I think that's one of the reasons why we had such good high levels of contact, but also the group that I talked about before, the hidden harm group, all the agencies pulling together, health visitors continuing to make sure they had sight of very young children. So, you know, everybody really going the extra mile during this period and you know, working hard. And when a lot of us were working from home, they were the ones who were still at the front line, who were going in and out of the houses with appropriate support. The third one, which you asked about, domestic abuse, we know this is a challenge in the area in Dundee, and I think again we work very closely with the Violence Against Women Partnership, and we work together. There's a lot of initiatives that identify children and young people in these positions, and we do record it. And we do all we can to support that matter too. So I don't know, again, whether, Glyn, you wish to talk a little bit about some of the initiatives that we're doing jointly with the Child Protection Committee and the Violence Against Women Partnership.
Yeah, and thank you, Bailey Wright, for the questions again, and thank you, Elaine. On levels of contact, I would also add, in fact, that we introduced a framework for social work staff, at least, which we described as a set of minimum practice requirements. So if they assessed a family to be high risk, medium risk or low risk, then they were seen on a face-to-face basis accordingly. Very often that was daily, in fact, and very often the face-to-face contact was accompanied by digital contact as well. So that gave them a flexible framework to make decisions within. And obviously we had the community support centres, and obviously as well, I've mentioned, we had the summer play activities with a range of supports delivered from the third sector. In relation to domestic abuse, building on existing arrangements, for instance, in relation to the Caledonian programme for perpetrators delivered by Community Justice and the range of victim support services available, we're also now implementing, as you know, Safe and Together. But building on that, we're about to implement a new CEDAR group work programme for non-convicted perpetrators of domestic abuse, so they get access to the right kind of support at the right time. They're not waiting for a conviction, or they're not waiting to meet certain levels of risk before they get support. We're implementing a test of change across the social work teams, which combines a number of these initiatives at the same time. And we're just about to implement a new initiative with the court called the Assist programme, which is essentially a court navigator initiative for victims of domestic abuse, which assists them through the process, assists them through the court process and the sentencing process for the offender, the perpetrator afterwards as well. And I know, Bailey Wright, you've also heard from previous meetings that Protecting People team and the partnership have been instrumental in applying for additional funding. So we reduced those waiting lists that have been referred to. So there's a range of additional work over and above that we already had in relation to domestic abuse, just to try and get us to that place where we need to be, because over 50% of children on the Child Protection Register are there because of experiences of domestic abuse.
Okay, Bailey Wright, are you happy with that, or is there any follow-up?
Yeah, just to say congratulations to the staff, and we should be immensely proud of what the staff have done, and it's down to the commitment, you know, that they have doing their job. They go beyond the call of duty. So please feed back to them. Well done.
No, absolutely, I absolutely agree with you and share your sentiment. I think the work the staff have done, particularly over the last 2 years of the pandemic, have been extraordinary, and I think that certainly we need to make sure that's fed back to staff. Bailey McPherson, you're next on my list.
Thank you. Could I start with echoing the comments of Bailey Wright and yourself there in relation to the commitment of staff in the most challenging of circumstances. And I think it pays a lot of tribute to the staff, not just in relation to maintaining a service in such challenging circumstances, but if we look at page 17 of the report, page 25 of the substantive page numbers, if you like, and where we're looking at some of the improving data, and in particular, between May and September of last year, the overall quality of support increasing as just one example. I think that pays testimony to the commitment and the hard work of all the staff. And I echo the point that Bailey Wright made there about ensuring, if Elaine and Glyn would do so, to ensure that the staff, the appreciation of this committee and of the City Council for their efforts is made clear to them, because I think we're all extremely grateful for having such wonderful and committed staff in the city in this challenging area of work. My question's about the issue of the higher level of child protection orders, which was touched on a little bit earlier, I have a couple of points regarding that. I appreciate that that can have something to do with demographics of a particular local authority. I fully understand that. But I was just really wondering if I could have some information about, when you say that other local authority areas, are we meaning as an average, or are we an outlier, if you like, in that respect? And I was just really wondering as well that the report alludes to further work being undertaken to see if earlier intervention can make a difference here. And I was just really wondering a little bit more detail around that, and if there is good practice from other local authority areas in relation to the early intervention aspect, because obviously it would be good to see our level of child protection orders going forward being more like the Scottish average, if that were possible.
Okay, again, I'll bring Elaine in first, and then if officers can answer part of that as well, we'll bring them in. So Elaine.
Well, just on the point of learning from other areas, yes, I think as a committee we do look to learning right across Scotland, but actually indeed across the UK. And I attend a national group, for example, that brings back examples from other areas, and we really need to learn from that. So one of the things we've been looking at is contextual safeguarding for young people, for example, and that's actually about looking not just about what's happening to that young person in their life, but actually in their community, and seeing whether we could intervene in a different way by actually, looking at what's happening in that community and not blaming the young person, if you like, for all the ills and everything that's happening to that person. So yes, absolutely agree. We need to look at beyond the city. In terms of earlier intervention, there's a lot of good comments in the inspection report about earlier intervention. But again, I think we could always do more. And I know in terms of the numbers of child protection orders, Glyn, I know, has been working on that with others to see what we can do. So I think, again, I'll just pass over to Glyn, if that's okay.
Yeah, again, thank you for the question, Bailey McPherson. Thank you again, Elaine. And yes, the number, the proportion at least, of CPOs in the city are higher than elsewhere. We do routinely check those. We audit them in partnership with the Children's Reporter. They're all seen as proportionate and necessary in terms of them being the right thing to do at the time. But again, yes, we would rather avoid such an intrusive measure in family lives. Arguably, it's one of the most intrusive measures in family lives, which nobody enjoys doing. What we're doing in response to that is that we're introducing a new question on our audit process to ask whether or not earlier preventative action could have been taken. That will inform conversations across the partnership about whether it could, and if so, what that might have been. But as Elaine also says, already across the partnership, and as was recognised by the Joint Inspection Team, we're implementing a range of measures that relate to improving approaches towards prevention. And in that regard, we have the new initiative that we're working on with Celsius. We have Team Around the Child arrangements. We have the FORT system, which promotes earlier access to the right kind of support. We have a range of mental health services across the system. I know the report recommends that we improve in relation to mental health, but actually we do have a range of mental health services that we need to make staff more aware of so they can access it in the right way at the right time. So broadly, we're happy at the moment with our responses in relation to the use of CPOs, but going forwards, we need to use information on that to get even better than we already are at prevention.
Okay, Bill McPherson, again, I'll just ask if you're happy with that, or is there anything else you wish to raise?
No, I'm very happy with that, and I'm grateful to both Elaine and Glyn for such comprehensive responses. Thank you.
Okay, Bailey Keenan, you're next on the list.
Okay, thanks very much for that, convener. Maybe a few questions. You know, it concerns me that we've seen at police committees an increase in domestic violence, and you know, always makes me think that there'll be quite a bit of domestic violence below the radar that isn't reported and it isn't coming up on a police report, and you know, that would no doubt have an effect if there's children at home. And I'm wondering if how we best guesstimate the numbers of children that we haven't managed to get there. I know that there's this work that Lynn just mentioned there in relation to looking at getting better at you know, identifying issues, you know, working in the community if that's the case, and how best we achieve that. And you know, given that we've got a multi-agency approach, and Elaine, you mentioned things like the quality assurance improvements that need to be in place, and wondering if there's any gaps that you see there at the moment, and if there's any sort of pressure points on the services we see at the moment. You know, always quite concerned that in multi-agency approaches to things that somebody else thinks someone else is doing it, and you know, you've not necessarily closed the gap on a quality assurance, that you've got a holistic approach to dealing with the problem. So, and it's, you know, a really complex area, but something that we would, because of the effect on someone's life for the rest of their days, want to get it right at the earliest possible stage. So, you know, if you could maybe give me some pointers on these, that would be great. And you know, if it's a case of there's pressure points, then you know, we as a committee need to have a look at what we would do to try to resolve these.
Okay, again, I'll pass over to Elaine to start off.
Thank you very much for that question. I think in terms of identifying numbers of children and young people who are involved with domestic violence, very difficult to absolutely quantify that, as you say, but we do work very closely with schools. And I guess schools are the first point which will pick some of this up. You know, if children are kind of coming into school and talking about these things, we do rely heavily, and we have really good education input to the committee, and work very closely with Audrey and her team as well around some of this. So I think that, yeah, I'm not sure we ever know, other than a guesstimate, but yeah, you're probably right. There's probably more going on than we are actually reporting through the data. But I know there's a big focus on it, and I'm assured that there's a lot of work going on, as we've outlined already, to address that in the city. So, but we can't be complacent. We have to keep a very close eye on it. In terms of your quality assurance, yes, I think we have had lots of reports on quality assurance, but they tend to be single agency. And I guess what I would like to see is more multi-agency working across the quality assurance part. So, for example, health may do case file audits, local authorities, social work may do case file audits, but then how do we do that together, and how do we actually help each other audit that, and therefore have a much more joined up approach? And I think that's what I would like to see this next coming year, is having a multi-agency quality assurance programme whereby we're sharing that data and we're helping each other, peer support if you like, and challenge each other around some of that. So it isn't just one agency looking at their own data or their own files, but actually we're cross-referencing that. So they're the kinds of approaches, Councillor Keener, that I think I would like to see in terms of progressing our quality assurance. But it's good to see we are doing it. It's perhaps just not as joined up as it could be. In terms of pressure points on services, I think others may be closer to the services angle than I do, but I just seek assurance at the committee that people will raise any issues if they feel there's gaps or there's pressures on staff. I think throughout the pandemic there have been pressures on staff right across the board, and I know all the work that has been doing to support the workforce through this. The other area is, I think, flexibility around one agency supporting another, and I think there's a lot of goodwill in Dundee to support that. So I'm not sure if that addresses all of the questions, Councillor Keenan, or whether any of the other officers want to come in.
I've just checked with Keenan to see if any of the other officers want to add anything, and I'll let you back in after that. So I don't know whether Glenn or Audrey want to add anything to that.
Happy to come in, convener, and thanks again, Bailey Keenan, for the question, and to Elaine. In my new role, obviously, I've become more involved in the Child Protection Committee, and I can just reinforce that discussion that we're having at that committee around how we need to, although we've got lots of really good agency quality assurance processes in, but we really do need to do that cross-referencing and pull together the data sets that we have that will help us to really ensure that we're all looking at the same children, the same young people, the same families, and getting that kind of cross-fertilisation of intelligence, if you like, to make sure our children are being supported in the best way they can. And just to reinforce the message Elaine had mentioned earlier, that schools have this on the radar, and absolutely we've made sure that we've had strong representation on the Child Protection Committee to make sure that we're joining the dots around the education agenda, as well as making sure first and foremost our children are protected. And as it's already been said, I think we've said it before, no one would have wished a pandemic for the last couple of years, but it really has brought together the teams of people who work with our children, our young people and our families in a way that we wouldn't want to lose. And I think, you know, Elaine referenced, Glenn has referenced things like the hidden harm work, and we are now bringing that into our core processes. This is now core business. It was something we brought in for the pandemic, but because the learning that's come from that by working multi-agency and cross-referencing our families and working together across these different protection committees, we see that we'd want to continue that into our core business going forward. So yeah, there's always more to do, and we would always want to improve our processes because of the importance of this area. But I think there's a lot of good work underway. So thanks to Elaine for her leadership in that as well. And of course, Glenn, who leads that part of our service.
Okay, Bailey Keenan, I'll bring you back in.
Convener, I think we'll just leave it at that. I could probably take up the night asking another few questions, but you know, I realise that there's a lot of good work went on, and again, I'd like to pass on my appreciation to the staff that work in that area. It's a difficult call, and they do a great job on behalf of the citizens of Dundee.
No, thank you very much for that. I don't see anybody else wishing to come in, so I'm just going to ask if that will be approved or agreed. Okay. So thank you, Elaine, for coming along, and really appreciate your participation tonight and your comments, and all the work that you and the committee have done over the last year. It's certainly very much appreciated, and as we've all said earlier on, the work that the staff has done has been absolutely amazing and first class, and really want that to be passed back to them as well. The appreciation of the whole committee of the work that they've done, especially over the last year or two through the pandemic. Okay.
Thank you very much for your interest and your questions. Thank you.
Okay. And with that, I think that's the business of the committee.
Thank you, Convener. The next committee is the Community Safety and Public Protection Committee.
Thank you, Roger. Welcome to the committee. Mr. Waddle, could you lead us off, please?
Yeah, thanks very much, Convener. Firstly, are there any declarations of interest? Okay, there being no declarations, that then takes you on to item 2, which is the Adult Support Protection Committee mid-term report. This is for noting.
Thank you. And I do hope Elaine has not gone home, because she wears many hats, and she will give I'd like to invite her to give a small introduction to this report, and then we'll open up for questions after that. Thank you.
Thank you very much. You'll be sick of me by the end of the night. So thank you for the opportunity to outline this report, and it is the Adult Support and Protection Committee report for the period April 20 to March 21. This is a mid-term report. The independent conveners have to produce a biannual report, which I brought to you last year, and that's our minimum requirement for reporting. But we feel very strongly that really committees such as yourselves need to get an update every year. So this is an annual mid-term report. Again, all the agencies attend this committee: health, local authority, third sector, police, and we work very closely together to try to keep adults safe. And there's overlaps with child protection as well, because particularly that younger age group, the 16 to 18-year-old, they straddle across two committees. So we work very closely with the Child Protection Committee as well. So the report, sorry if you can hear my dog in the background, the report identifies a number of achievements that we have made this last year. I'm very pleased to report the Learning and Development Programme is really good, and it's well received right across the multi-agency, but we've particularly done one on council officers, and that's helped them to understand their significant role in this agenda, because they're the ones that are undertaking the investigations in terms of adult support and protection. So they've been meeting together and really developing their role and getting training and support to do that. We have had improved collation, collection and scrutiny of data, and that has been important. And again, getting into a cycle of analysing the data, asking the questions and looking beyond what that presents. And again, you can see some of the data in the report before you. We've been reviewing some of our operational protocols, particularly around things like initial referral discussions or interagency referral discussions, and some of that work's been led by our partners, for example, in the police. And there's been significant investment by the NHS in this agenda in terms of additional posts, and that's really helped this last year, and I'm sure there's improvements as we move forward. You'll notice in the report that I've referenced a thematic review of fire deaths. That was a significant piece of work. What we noticed was there was a number of people who unfortunately had died in their house. There was about 3 of those all together in a short period of time. So what we did was we looked at that as a thematic review, and that's been really, really informative to look at improvement areas that we can make to make sure that people who have perhaps significant disabilities, who perhaps can't get out of their house as quickly as we would like, have got proper plans in place to ensure that we reduce the risk to that group moving forward. Again, this last year, this period, was the response to the pandemic. We know that adults and families all experienced significant pressures during the pandemic. The isolation, particularly of older people, when they were being advised not to go out and meet other people, and that meant there was perhaps more risks for older people in terms of being isolated at home. And people having mental health difficulties, lots of anxieties around some of this. So we know that the pressures on people have been difficult. We also know that some of the money matters, people perhaps not being able to get out to work, that's also increased significant pressures on adults and families. So we've done quite a bit of public awareness raising, particularly around highlighting things like scams, so that if you're an older person at home and your only contact is telephone and you're getting people coming asking you for monies, that we've been trying to highlight, some of these risks so that people can protect themselves. And indeed, if any neighbours identify that we can make sure that they are supported appropriately. And again, we've been trying to make sure that we've been focusing on anybody that hasn't been seen, and that so they can get appropriate support and help and there's a lot of work done through the pandemic in terms of people getting food appropriately when they couldn't get out of their homes. So all of that actually impacts and helps with the adult support and protection agenda. And again, a big thanks to staff who were out seeing people, following up, doing investigations during this period using appropriate PPE. And again, I think that's been a tribute to them in terms of their flexibility and multi-agency working, people working together. The committee met much more regularly, and again, we shared information and we supported each other during that period with particularly a risk register, which identified any risks and any mitigating actions. The data in the report, adult concern reports continued to rise. They dropped a little bit at the beginning of the pandemic and then they rose. And although I think it's recognised that a substantial number don't meet the threshold for an investigation, a formal investigation, I think we would, at the committee, we're really keen that we make sure that all are followed up and everybody's appropriately supported. So even if it doesn't go on to a formal investigation, people get the appropriate support. And finally, we just highlighted the future work that we'll be doing in terms of workforce developments, making sure that we hear the voice of adults who are at risk and we get feedback so that any intervention that we do make makes a big difference to people's lives and we know that people feel safer. So we need to get better at getting that feedback loop, I guess, in terms of that. And again, quality assurance. Again, we've had a number of quality assurance reports, but I would like to see those more joined up. Yesterday, just to say, was Adult Support and Protection Day. It was a national day, and I think there was a little bit of coverage on the TV, I understand, but you know, it's a good time to be presenting this report to the committee because this week we've got a number of activities that are happening for Adult Support and Protection Week for staff to join various lunchtime and other sessions. So it's a good time to raise the profile because this is an important agenda for everybody in Dundee, and I think this report highlights you know, what we're doing about it and how people can be supported and if they have difficulties and are feeling vulnerable during this time. So thank you, Councillor Caudle, for that introduction. Hopefully that's a helpful introduction.
It was. Thank you very much for that in-depth introduction there, Elaine. And I see Billy Wright would like to come in on that, please.
The report clearly reflects lots of progress that has been made across the agencies in the last year. However, the Council's Scrutiny Committee recently considered an internal audit report that highlighted some outstanding areas for improvement, and that was in relation to adult support and protection practice within health and social care. My question is, can the independent convener comment on how she is ensuring that the issues identified in that report are fully addressed? Also, the report does not include information about how concerns for adults who live in care homes have been considered by the Adult Support and Protection Committee during the pandemic, obviously, which has been a big area of concern for the public. So could you tell us more about what role the Adult Protection Committee has had in ensuring adults at risk are protected in these settings? You also mentioned that section 4.4.1, the report notes a thematic review of fire deaths and the fact that it being completed. I was just wondering if you could tell us a little bit more about the findings from this work and how our partners are actually addressing these issues. Thank you.
Right, thank you for those questions. I'll try to deal with them one by one, and perhaps I'll get a bit of support from Diane in her role for part of this. So, yeah, I'm pleased you've highlighted the issue of the Scrutiny Committee, because that came to the last Adult Support and Protection Committee meeting, and obviously it was highlighting that there's some areas that were highlighted during the last inspection, which is a few years ago now, that we still are working on, and we really need to get a bit more pace, I think, in terms of taking these forward. And I think we've recognised that. There's been a number of reasons for that. One was we worked on some of these issues as part of a public protection approach, which meant that some of them we implemented first in the children and young people's arena, and then we're rolling out into adult protection. And perhaps it's taken longer than we had anticipated. So we do need to pick up the pace around that and make sure that these actions are followed through. And we will be making sure at every committee that we monitor this and we're updating the action plan around that. So I think, yeah, absolutely need to make sure that we're following that through. I'm not sure if Diane wants to say a little bit more on that item.
Yeah, thank you, Elaine, and thank you, Billy. Right. Yes, I absolutely agree with what Elaine has said. We very much took a cross-service approach to this, developing bits of work in different areas, and then the intention to roll that out. Very much ties into the work that we've been doing in terms of a lot of the training around council officers. Our approach has been very much about getting the frontline staff involved in the redesign and the testing of that work. And while we'll continue to do that, we'll also make sure that we're doing that while implementing the parts of work that we need to do. So action plans being developed. We put ourselves quite tight timescales in order to make sure that goes through, and we'll be looking to ensure that built into that is further evaluation with the workforce. Thank you.
I think you second.
Can I say thanks for that part, Diane, because I think it's very useful to know that you are actually listening to the staff, because often it's the staff that comes up with the really good ideas. So thanks for that.
Shall I move on to the second question, which is about care homes? I think, yeah, the Adult Support and Protection Committee doesn't have direct responsibility for care homes, so therefore it perhaps hasn't featured in the report in the same way it would have done had that been the situation. However, it was a key risk area that we monitored through the pandemic, because we were aware that there was a lot of concerns about what was happening in care homes. So Diane came regularly to the committee with an update for us. And I guess what we were doing at the committee was assuring ourselves that, for example, the PPE was in place so that people had, and that the health and safety measures were in place within the care homes. And we did get that assurance that you know, that was being followed through. And I'm sure if there were any concerns about that, we would have raised them further at the Chief Officers Group. So I think that it was being monitored as a risk, but we didn't actually find any concerns about the arrangements in terms of the protection of adults at risk of harm in terms of the legislation. So I think we did look at it, but it hasn't featured heavily, as you said, in the annual report. I'll perhaps just touch on your final question and then ask Diane to come back if she had any additional points to that. So the thematic review of fire deaths, which I did mention, yes, that was a very detailed piece of work, and there are a number of improvement areas that we have been raising with managers to address them, and again an action plan to take that forward. But some of the key themes that were coming out of there was thorough risk assessments, particularly around when people were being discharged home, for example, from hospital. And I think we could put in better detailed risk discharge planning, particularly when people are returning to their homes and immobile, and we know that they're living in properties that they may not be able to get out of without support. So that's very clearly a theme. Evacuation planning, what's in place in terms of helping people to get out if there is an unfortunate fire in the house, and making sure that teams are beginning to look at those recommendations, and we need to audit practice against the recommendations to make sure that they're fully embedded and actually they're being addressed. So I think there's a lot of work going on in that area. We are making sure that we're talking about it and making sure that people are aware of it, and that the teams are actually implementing those actions. So hopefully that covers that point. Diane, I'm not sure if you want to come back on particularly the care homes.
Yes, Lynn, thank you. So Bailey, right, the reason it probably didn't feature quite so much in the Adult Support and Protection Committee is that there was actually a group that was set up in order to support and monitor care homes during the pandemic. There was quite a lot of significant external Scottish Government funding in order to put posts in, both in terms of support, but also to ensure that we were looking at the kind of policies that the care homes are working to, supporting them in terms of providing information in which to evaluate the position that they were in, and making sure that we were undertaking supportive visits to care homes. And we've done 2 and in some cases 3 kind of programmes of that work. So because there was such a high profile in regards to monitoring and particularly supporting care homes, the reporting into Adult Support and Protection Committees was made on that basis. Those oversight groups continue to meet. At one point they were meeting daily. I think we're down to once a fortnight just now, and we continue to have additional funding in order to put in the kind of posts that we think are the right kind of support. We were at a session today where people were saying it's good to start thinking about the work that's there much more from an adult support and protection position. So I think we'll start to see more of that information coming through, including things like large-scale investigations.
Okay. Thank you very much for that, and well done.
Thank you, Billy. Right. Bailey Keenan, I see you wish to ask a question.
Okay. Yeah, Convener, it's maybe one more for yourself. I'm wondering what committee has been given in relation to you know, the work that's went on with the protection of adults in relation to fire in their home and protecting them, and whether there is a report that needs to come to us that suggests these are the measures that we need to put into place, you know, and how early could we put them into place so as that, you know, we don't have any other death through, you know, someone being allowed out of hospital earlier, but they didn't have a good evacuation plan, or you know, we're putting them back into a home that wasn't necessarily the best place for them to be. Families will clearly want their loved ones home as early as possible, but you know, if there is some measures that we could put into place that would make that happen. So I'm just wondering whether it would be your intention to bring forward some report, or I'm basically requesting that.
Yeah. Yeah, we could certainly bring a report through on the thematic fire review. We do report it up to the Chief Officers Group, and we report the actions up through that. But if it was the will of the committee that you wished further details, we could do that, I'm sure. Obviously, we've been working really closely with housing. Housing's a key partner in this work, and also just to say there's been some national interest in this work that we've been doing as well, because I don't think this is just an isolated issue for Dundee. It has raised the profile of this particular area of work. So if the wish is for us to bring something with more detail back with the actions and what we're doing about it, I'm happy to support that.
I mean, I'd certainly appreciate that. I asked similar questions at a fire committee, and you know, it was probably at its infancy then. But if it's now getting to the stage where we should be putting something in place, then I think it's really of the interests of us as councillors that we're made aware of that, so as that we are certainly making sure that it happens.
Yeah, and actions are happening, so it's not as if people are sitting waiting. But yeah, absolutely, and we work very closely with our partners in fire, the fire service for that report as well. So yes, absolutely, happy to do that.
Thank you.
Okay, thank you for that, Elaine, and thank you, Bailey Keenan. I see no further questions on this, so again, reiterating all the previous comments from the last committee to Elaine there, that you know, staff are so vital in getting all this work done for us, and I hear the appreciation coming from the committee previously, and I hope those views would be shared on this committee as well. So thank you for coming, Elaine, and keeping us informed of the work. And with that, is this noted? Thank you. Mr. Waddell.
Thanks very much, Convener. Item 3 then before you is the report on arrangements for managing high-risk offenders. You're asked to agree the recommendations.
Okay, and I'd like to introduce Alan Small, who's the independent chair of the Tayside MAPA Strategic Oversight Group, to introduce the report. Thank you.
Good evening. Yes, this is my first report, my first annual report as chair of the Tayside MAPA SOG. So I need to acknowledge Elaine Torrance, who has just obviously talked to you for some time, who was the previous chair of the Tayside MAPA SOG, and I took over from Elaine in September 2020. So this report actually covers about 6 months of my tenure, because it covers the time of 1st of April 2020 to 31st of March 2021, which will be indelibly stamped in all our minds for the rest of our lives, I think, that period. Because of course that covers the first lockdown that we had and the intensity of the pandemic that we lived through. And I think it's particularly pertinent that the report actually talks about a year like no other. And it was in fact a year like no other that I think any of us had ever experienced. I would like to say a big thanks to all the partners across Tayside, particularly Dundee, because it's relevant to this meeting, for the way they quickly adapted to the new ways of working. And that wasn't easy, and it was done sometimes erratically, I think, initially over the first month, but then we very quickly fell into being able to have meetings on a virtual basis such as this one. I mean, who would ever have thought a couple of years ago that you'd be sitting at a council meeting in a virtual environment? Well, we've really moved on, and it really assisted the MAPA world. But I think it's important that when you're dealing with people who are high risk to the public, we don't just deal with them over virtual environments. And there were many occasions where phone calls were used and occasional video calls were used. However, those who were at the highest risk still were subject to a visit regime with appropriate risk assessment by Police Scotland and by community justice officers. I think that there were a few things that we promised to do, or Elaine's report the year before promised to do, and we've achieved almost all of them. In particular, we've moved on to having quite a focused working group environment with the MAPA SOG. You have to appreciate that a strategic meeting which covers 3 local authorities, 1 police force and 1 health board is not the best place to actually move forward areas of work. So we've introduced bespoke working groups for self-evaluation and training, a group for case review oversight as well, because obviously Tayside have had 2 case reviews over the past few years, and very much as Elaine alluded to, it's all very well having a case review and having recommendations, and once the recommendations are in place, whether it be a piece of policy or a practice change, you tick the box, but that's really not good enough. We need to go back and actually have a look at how that's impacting practice, whether it's making any change, whether it's actually making any improvement. And the only way to do that is through a process of self-evaluation. So although we have a self-evaluation subgroup, that case review group has actually been looking at the recommendations made through the 2 significant case reviews and drilling down into what difference they actually make, and how can we assure ourselves as a SOG that in fact there has been an improvement and it's not just a tick the box exercise. And what has happened, and is about to happen over the next 6 months, is that those improvements and the evaluation of those improvements will in the main be handed over to a self-evaluation group, and they will become business as usual. So the examination of them will become business as usual. One of the other improvements we've made is we have introduced a much more detailed and complex data report. And that report, it probably will change a bit more in the future, because we are awaiting on the 31st of March the Scottish Government to publish revised MAPA guidance for the whole of Scotland. And within that, there will be prerequisite items of data that we need to examine and report on. However, currently what we're focused on is actually what makes a difference to the strategic management of MAPA and Tayside. Not what's interesting and what's good to know, but what we can actually use and what we can move forward. And I can tell you it's been quite interesting over that period, that first year of the pandemic, because Tayside's been a bit of an outlier in Scotland.
we had a drop of about 50 registered sex offenders during that period. Now, that has not been matched in any other area. I think the only other area that had a drop was down about 17. And what's even more interesting about that drop is specific to Angus and Dundee. And in Dundee, our registered sex offenders numbers dropped by 18. And that's quite significant. And there was a drop in Angus as well, but then a very slight rise in Perth and Kinross. And I would love to be able to tell you what the definitive reason is for that, but I can't. I can tell you, I'm going to be honest with you, I can't. We do think it's something to do with the court system and the fact that courts haven't been operating as normally. But the question in my mind, and the question in your mind perhaps, would be, well, what's different about Perth and Kinross, because we're in the same sheriffdom? So that's something we're continuing to monitor. But as I speak, the numbers are going back to where we'd expect them to be. And that is very much the courts starting to move forward. Now, there's an issue with registered sex offenders because at the point of sentencing, you do not necessarily become a registered sex offender. That happens. Sorry, at the point of conviction, that happens at sentencing. But we've moved forward with that. And in the Tayside area, we've actually started to put risk management in place for offenders at that point of conviction and not waiting for sentencing. So I mentioned the new ways of working, and they're not just restricted to how partners worked, because partners have been really innovative, and we've made great use of Microsoft Teams. I can tell you now, I attend many more meetings than I would in my normal working day 2 years ago. It's a click of a button, and we're there, and that has really increased efficiency. But we have lost something in that face-to-face, and it's important when we deal with offenders that new and ways of working with offenders were introduced. So things like going for a walk in the park were introduced as a really positive step forward. There's a bit of a pun there in the word, use of the word step, but a bit of positive move forward. And we know, because we've done a bit of evaluation with the registered sex offenders, that we seek to protect, and by that protect others from them, that they actually quite liked some of the new ways of working. So things like that will actually be held on to, and maybe it won't be standard, because at times you need to get into a registered sex offender's home to look at their internet device, to look at their environment, to see how they're living. But certainly things like that will be held on to, and we'll move on. And I'm delighted that we've managed to do some engagement with registered sex offenders to actually understand what works for them, and to understand how they actually feel about the process. It's amazing how many of them don't actually even realise that they are being managed under MAPA and don't actually understand the whole process, even although that's explained right at the very start of the process. But I suppose there'll be a shock aspect to that. So I think we need to continue that, because we do need to understand what works for registered sex offenders and what doesn't. You know, and there's a thought about doing exit interviews, because if somebody does eventually reach the end of the sex offender registration, then MAPA has worked, and MAPA does work in the main. There are very few instances of registered sex offenders re-offending, I'm delighted to say. I would like to actually comment on the work of partners, and I think in NHS Tayside need a bit of highlighting, because they have actually dedicated staff to MAPA, as Elaine has, I think, maybe alluded to. They have to adult protection, and I think that's quite unusual across Scotland, and that's really to be commended. And the Scottish Prison Service, who have really embraced the improvements that we needed to take forward after the significant case reviews, and who are very regular. The governors of both prisons are very regular attenders, if not always attending the MAPA strategic oversight groups. We have to appreciate that Castle Huntly, during this period, probably moved from being an open prison to a closed prison. So it's been quite difficult to look at how prisoners who have access to the community are managed during that period. We are ambitious to move forward over the next year, and that year's, it's well in vogue now already. We are continuing to look at training, continuing to look at how we improve through self-evaluation and our case review work. And we know we've got a bit of work to do on a communication strategy. It's a really difficult balance to talk about registered sex offenders with the public, because you have to make sure that we don't alarm people and we don't upset people. But there really has to be some knowledge out there with the public in general, with people who work in services, and with elected members, as to how MAPA is really effective at managing risk and helping people or preventing people under the MAPA management for further offending. And it is an extremely safe process. So we need to get our communication strategy right. We need to be able to deal with outings that happen, and when they happen, they have a knock-on effect on accommodation, they have a knock-on effect on how we deal with offenders in the community. So we need to get that positive message over without being alarmist. So we're going to be working hard at that over the next year. It's not been easy. We've been meeting every 6 weeks as a MAPA SOG, and only very recently, in the recent weeks, have we decided to go back to quarterly meetings. And that is a situation that we'll continue to assess and move forward. But I think it just shows agility of the MAPA partners in Tayside, and specifically in your interest in Dundee. We, as I said before, we await the publication of the new MAPA guidance on or before the 31st of March. We have seen a draft, but there were many things within that draft that we commented on and that I know that other areas commented on. So we don't yet know exactly what that will look like. However, it should future-proof multi-agency public protection arrangements in Scotland for the next few years. So I commend the report to you. I think it's an easy to read report and it's full of quite interesting information. I'm delighted with it and I'm more than happy to take questions. And I see Glyn on the call. I'm quite sure Glyn will assist in answering any that I am not able to.
Thank you very much for that, Alan. I mean, very thorough and enthusiastic introduction, I think, and your enthusiasm for the work going forward, I think, has certainly come over there for committee. Now, we have a couple of questions. First is from Bailey Wright.
Okay, thank you, convener, and thank you, Alan. And I wish you all the best in your job. And know you have big shoes to fill. As you mentioned, Elaine's name, and I'm sure you've thrown yourself into it, and you're going to do a great job for us. My question is in 3 parts. Section 4.5.2 refers to the significant case reviews for Person X and Prisoner Z. My question is, what progress has been made in completing the improvement actions from these reports, and how do we know these are having the intended impact? Then on section 4.6 of the report notes that the reduction in convicted RSOs is likely to be associated with the impact of the pandemic on the court business, as you have said. So my question there is, when do we expect these issues to be resolved? And how will services continue to manage these impacts in the meantime? And lastly, I note from the report that National MAPA guidance, as you have said already, is currently being revised. I'm just curious about how well placed are local partners to respond to the changes in the guidance. Has there been any preparatory work done with them?
Okay, thanks for that. So I'll take that in bite-sized chunks. I'm confident that both of the significant case reviews, the action plans, are complete. That there's one action outstanding, and that actually relates to the national guidance, and that's completely out with our control, and we really need to wait on that being published. There's a section within the new national guidance which relates to how the Scottish Prison Service manage offenders who are considered suitable for access to the community. And until we see that in its final format, I don't think we can be happy that we've signed off that action plan. As I said before, this is more than just an action plan, because an action plan, by its very name, you have an action, you complete an action. So what we've actually done is we've taken forward this self-evaluation work, and that's answering the so what question. So you introduce a new piece of policy or practice, tick the box, so what difference does it make? Is it actually keeping people safer? And that's a question, that's a very, very difficult question to answer, but those are the questions we're trying to answer by audit and by further examination of the policies and the practice that we've brought about. So I'm confident we're in a good place with that. I'm not saying that everything's perfect, but I think it's as perfect as it possibly can be in relation to those two significant case reviews. I can't give you any guarantee that the issues that occurred before won't in some way manifest again, but if they do, it won't be through the lack of effort and the lack of planning and coordination from the Tayside MAPA-SOG. We can only do as much as we can, obviously individuals that sometimes make decisions that are out with their control. I don't know if you want to come back to me on that before I go into the court issue and the number of the fallen RSOs. I'm sorry, Bailey, you're on mute.
Sorry, it's a bad habit. No, I'm happy with what you've said so far.
Okay, so for the court issue, we do think there is something about the fact that the courts have been progressing very slowly, and there's might been a massive backlog in cases, and that probably has impacted on the numbers. I raise again that anomaly. It's impacted in Dundee and Angus, but hasn't impacted in Perth and Kinross. And why that is, maybe Perth and Kinross would have seen an increase during the period. Who knows? But the court system is starting to open up now, and in the last few weeks it has really started to open up. That's good, but it's a problem as well. And you're actually right to mention the fact that we need to make sure that we don't get hit with a flood of new offenders coming through, and that actually impacts on partners' ability to manage them. So we're keeping a very, very close eye on that. And from a Dundee point of view, Glenn and Martin Day, the service manager for community justice, Martin gives us regular updates about how the court system is opening up. At the moment, it doesn't appear to be an issue, but we don't know how that will pan out. But we are keeping an eye on it. And the new way that we're managing performance really helps us do that. So at the moment, it doesn't appear to be an issue, but you're right to actually mention it, because if there has been a backlog, that backlog will eventually be cleared. But we're talking now about years before that backlog's cleared, I believe. So that will probably happen in more a dripping fashion than a wave that hits us. And finally, before I hand over to Glenn and bring him in, the new MAPA guidance, well, we did see a draft and we have commented on the draft. So we have an idea about what some of the changes will be. However, we don't know definitively what the changes will be, but we are prepared for it, and we are prepared to take account. And it won't be a case of on the 31st of March, a button will be pressed and we'll immediately have to comply to the guidance. There will be that period of implementation that we'll look at and that we'll manage and we'll deal with. From looking at the draft, there is nothing, there's a couple of issues, I suppose, which gave me some concern, but there's nothing I think that would give the SOG any great concerns. And those issues we've already fed back to the Scottish Government, and I'm fairly confident they'll take them in cognizance before the final version is released. I'm talking about the 31st of March. That's the final date. It may well, hopefully, it'll hit us before then, and we'll have sight of it. So I'm going to ask Glenn now to come in, and I'm sorry, Glenn, I should have brought you in earlier and maybe comment on anything that I've said, and no doubt add to the quality of my response.
Thank you, Alan, and thank you, Bailey. And I would only add, because Alan's given such comprehensive answers to all three questions, is that in relation to the impacts of the pandemic on court business, there have been a range of mitigations put in place, both by the court and by the police, and in fact by ourselves. So police bail conditions have still applied, and they've still imposed bail conditions, including on registered sex offenders. The court itself has prioritised high risk of harm cases, so people that commit sex offences, people that perpetrate domestic abuse, have still appeared in court. There's been a higher proportion of people remanded at HMP Perth, and we know from SPS colleagues down in Perth that a significant number of those have been registered sex offender as well. Alan's mentioned that we've implemented MAPA at the point of conviction rather than sentence, and also we've maintained the frequency of levels of both face-to-face and digital contact. And in terms of recovery going forwards, yes, the volume of work coming out of the court is now starting to increase again, but the service has been given additional ring-fenced Scottish Government funding to cope with that increased level of demand. And at this stage at least, although we'll continue to monitor it, at this stage at least, we're confident that we'll have the capacity to do just that going forwards.
Thank you for that.
Thank you for that, Glenn and Alan. I see Councillor Duncan wishes to come in.
Thanks, convener. Just to say, also welcome Alan Small into the new role, and as you yourself, convener, said, he delivered a comprehensive and enthusiastic introduction to this report. And actually, a lot of what I was going to ask about has been covered, really, about the decrease in numbers in Angus and Dundee. Which on the face of it, I'd like to say I'm delighted, but something tells me that that's probably not because the number of offences have unfortunately really dropped in reality. And you've also highlighted the Perth and Kinross anomaly. As you've already said, you don't really have an awful lot of more background information to offer us tonight, but I'd be interested perhaps at a later stage to just know, to maybe drill down on these figures a bit more to discover what's behind them, because although we've heard that probably a lot of it is down to the courts being, not functioning as normal, and hopefully that will start to unblock, as it were. But I also do wonder, during the almost 2 years of the pandemic, have the police been perhaps investigating such matters as, dare I say, rigorously as they might in normal times, or have they had their hands full with other matters? I'm just really trying to drive at what is actually behind these figures.
Yeah, well, there's a few things there. I see Martin Day's on the call now as well, so I'll bring Martin as well as Glenn in there. You could have a glass half full or a glass half empty view of it. And the glass half full is that, yeah, possibly we've been doing a much better job at prevention, than perhaps during that period there has been less opportunity to commit sexual offences. And then you could have the glass half empty approach and say, well, that's probably not the case, and it is probably more down to the fact that, quote, business has slowed. The Police Scotland, it's more for Police Scotland to respond to this, but I am aware that there is a backlog, particularly in packages in relation to internet offences. And we know that in general, during that period of time, not just internet offending, sexual offending, internet offending in general, scams, etc., all increased, basically because people didn't have the same opportunity for face-to-face contact. So that could have something to do with it. And it's something that we're continuing to look at as we move on. As I've said to you, the figures are starting to return to where we would expect them to be. And that may well point, I think, to a number of reasons. I just don't understand the difference between Perth and Kinross and Dundee and Angus. And I don't think any of us do definitively. And I'm going to bring Martin, who is a bit of an expert, and Glenn, who's much more informed than me. But certainly as a SOG, we have been debating it, and we are continuing to look at it and try and understand what it is. As I say, we were only, I think, one of 2 areas in Scotland that actually saw a decrease. Most either stayed around the same number-wise or have risen slightly. But our decrease was much more severe than anywhere else. So it's a difficult question to answer. I don't have the answer. We are continuing to look at it. And hopefully, maybe this time next year, we'll be able to come back with... You can never have a definitive answer about these things. You can hypothesize. And that's probably where we'll end up being, but we might feel more comfortable about a position in a year's time. So I don't know if Martin or Glenn would like to come in on that.
Thanks, Alan. It really isn't a great deal to add. I think we have not at all viewed this as a straightforward reduction, and we must try and understand it. I think the police could, and we will work with them in the Community Justice Partnership to look at whether it's a reduction in contact offences, but certainly the internet offending and the internet monitoring that the police are able to do remotely has gone on throughout the pandemic, so that's been undiminished. I think it's something we will continue to try and understand more. As you say, it's a very strange thing that we're actually trying to find out why we've had the reduction in registered sex offenders in the community, but we will keep working on it in the Community Justice Partnership.
Okay, thanks very much for these really open and helpful answers. And as you've alluded to, I mean, sometimes the exact truth is hard to establish, at this point in time. But I mean, I'm particularly struck, you know, that during the 2 years of the pandemic, I mean, I know that we were not in total lockdown for 2 years entirely, but nevertheless, the opportunities for some of these offenders to do what they might do were reduced, and I think you're right, and it's not surprising that perhaps that's why there's been something of an increase in internet activity, and that's been mentioned at previous committees with the police and so forth. So, I mean, once again, thanks for the answers, and I'd just really be very interested at a future date. I think we all would, to just see the possible explanations behind these figures. Thanks.
Thank you for that, Councillor Duncan. Let's see no more questions. So thank you, Alan, for coming tonight and showing us the enthusiasm you have for the work. And I'm sure we all look forward to working with you going forward. So with that, is this report noted? Thank you. Mr. Waddle.
Thanks very much, Convener. With the recommendations agreed, takes you on to item 4, which is the Food Safety Service Plan, and you're asked to give the proposal.
I'm just going to open the floor to any questions on that report. And I'm not seeing any questions. So with that, is that report agreed? Thank you. Mr. Waddle.
Yeah, thanks again, Convener. Item 5, then, before you, the report on Dundee low emission zone, you're asked to give the proposals.
Again, I'd just like to open it to questions. So I think Bailey McPherson.
Thanks indeed, Convener, and I have no problem with the recommendation, and obviously there's been an extensive consultation period and process with regard to this, and obviously a number of issues have been discussed and debated, and feedback from the public and others. My question really is about the scope for review once the low emission zone is in place. Now, I'm conscious of the fact that there'll be a 2-year period where there is no enforcement, and I'm wondering, is there a statutory time frame in relation to it? And what I'm thinking of in particular about review is we've made some decisions about the boundary and what's in and what's out, and these are, you know, there's been a considerable debate. I know from my own constituents, there's been a considerable debate about where the boundary should lie. And what I'm really wondering is how, you know, obviously you want to see how the LEZ starts to operate before you start to review. But what I'm really wondering is what officers feel is a reasonable time frame in which looking at how well the boundary is operating and if any tweaks or extensions to it are in the view of officers worth recommending to committee at some point in the future.
I'll invite Tom in on that one.
Thank you, Convener. Yeah, the legislation that allows for a low emission zone to be amended or indeed revoked at some stage. We do have to, the statute requires us to produce annual reports on the low emission zone, so we'll be doing that. There's 2 aspects to that. There's the administrative aspect, but there's also how well it's performing and helping deliver on our air quality objectives and indeed sort of climate objectives. So our plan would be we have to bring a report annually to the requirement will still be there for us to report to committee on air quality annually, and there'll be a low emission zone section so members will be able to see what you know, and overall how we're doing on air quality, but specifically you know, how we feel the low emission zone is performing in achieving those objectives. So there will be there certainly will be reports coming to members to see how we're performing, and also the legislation does allow for changes to the low emission zone.
That's greatly appreciated, Mr. Stirling, and I'm grateful for that response. I appreciate that any the point at which you look at reviewing the operation can only really come after a reasonable period of the zone being in operation. And I suspect, and I'm sure we would all agree, that driver behaviour will alter when enforcement commences in 2024. There's absolutely no doubt that when there is, no enforcement, driver behaviour may be rather different than when there is. But I'm grateful for the fact that we can review this. As you can appreciate, there's been a significant debate amongst my own constituents about the reasons why you should or should not include Lochie Road, which I'm sure Mr Stirling and other members, the members of the committee know I've been frankly going on about the air quality there for a very, very long time. There are good reasons for the decision. I had real concerns about displacement of vehicles into residential areas, and clearly the fact that the LEZ, all buses leading to the city centre will certainly assist. And I have to say, to the great credit of Explore Dundee, they've brought electric buses up and down Lochie Road, which is appreciated. But I'm very keen that we see how well this works and that we've got the scope for tweaking it in the future if necessary. So Mr Stirling's response is greatly appreciated. Thank you.
Thank you for that, Billy McPherson. See Billy Wright wanting to come in.
Yeah, thank you. I welcome the report, but obviously I agree with what some of Billy McPherson has been speaking about. I would like to have it been a larger area, had been included, especially around schools and nurseries, so that we could protect children and vulnerable people and people that have chest problems and breathing issues. So my question is, at some time in the future, will this area be extended?
Tom, would you like to come in on that one?
Thanks, convener. Well, the process that we've followed to arrive at where we've got to, and the scheme that we have followed the National Low Emission Framework and the guidance on that. It would be very difficult to just add in school areas and nursery areas as kind of individual hotspots, and that leaves you with the idea that the difficulty then is what area do you make it, because you have to be able to reasonably enforce it. It also has to be proportionate in terms of what we do, in terms of the need to do it, and also the costs associated with that. So it is something we can review. That as I said in my previous answer, the extent of the low emission zone, but it would require us to follow that low emission framework process. But we can do that. I mean, hopefully, and it's based on where we fail to meet the objectives, particularly for nitrogen dioxide, in terms of air quality. So most of those hotspot areas do lie within the city centre. Lochie Road is an area where we do have exceedances, which we've discussed. So the rationale for having a low emission zone is based on those limit values. We don't exceed those limit values around schools that we have in the city. The issues around traffic management around schools and nurseries and road safety is a different matter, and not one that would lend itself easily to be controlled by a low emission zone. But the principle of looking at and reviewing low emission zones is one that's there in the legislation, and we do have to report on it annually.
Yeah, my concern, there is a high amount of children, school children who actually have asthma and allergies, and there's a high proportion in Dundee in particular with people who suffer through the emissions traffic. People that have asthma, COPD and bronchitis all suffer, and if we listen to the health experts, is quite high in this city. So I would hope that it be extended to other roads, and try and keep some of the the juggernauts from coming in through certain areas because the pollution has been quite bad in some of the roads like Lochie and also in the Forfar Road as well. So that's what I'm hoping for. Let's make life easier and healthier for our school children. And if you're looking at some of the schools are on our main roads, and the pollution in the air is quite bad in and around like Morgan Academy, Clippington School, etc. So these are the areas that I would like to see a bit more protection from. Thank you.
Okay, thank you, Billy Wright. Councillor McCready.
Sorry, just to follow up on Bailey McPherson's question and Bailey Wright's question. I mean, I think obviously we need to let the low emission zone come into force and see how it works. But I mean, can Mr. Stirling confirm that you know, I heard his answers to both those councillors. You know, that the low emission zone might not be the issue, might not be the way to deal with some of the issues. You know, officers and others have made the case that it's not the way to deal with it. Some of the issues in Lochie Road that you might lead to displacement, as Bailey McPherson has suggested, and that it wouldn't be appropriate for a low emission zone to be in around different schools across the city. But it is the case, is it not, that that's not the only way that the council will be dealing with these things. The council has got a duty to look at air quality in the round. There's an air quality improvement zone across the whole city, and that's reported on annually. And that I absolutely agree with Bailey Wright that I know that there are people in the University of Dundee and Nine Mills Hospital, raising real concerns around air quality around schools, and whether meeting the legal limits is good enough, and it's something that I think we do need to look at. But it's good to hear that there'll be regular reports on the low emission zone, but there are other tools in the council's box and in other public sector, other areas of government that could deal with some of these issues, and that this will remain a priority for the council. That the low emission zone needs to be a success in the city centre, and that may well have impact across the rest of the city, and hopefully will have an impact across the rest of the city. But there are other things that we can be doing as well. Thanks, convener.
Thank you, Councillor McCready. I don't know if you want to come in on that, Tom.
Just to say that we do have a wider air quality action plan that looks at a host of measures, but wider than just focused on the air quality aspects. That there are, as we know, policies in place and funding to promote active travel that colleagues said development could probably see more of. There's the climate action plan that is focused on reducing the way people travel around the city. So all of these things are going to assist, and I think all the way through we've said the low emission zone is not the answer to all the solutions. It's just one to all these issues. It's one strand in a whole range of measures that we can look to improve air quality in the city.
Thank you, Tom. I'm going to let Robin Presswood in, and then Councillor Short afterwards.
Many thanks, convener. I think, as Councillor McCready has emphasised, there are a number of tools that we will be deploying in conjunction with the LEZ to try and address air quality within the Lochie Road area. I think the first point to emphasise is that because much of the traffic going down Lochie Road is heading for the city centre, improvements in air quality from those vehicles will deliver improvements around Lochie Road. I think members have been previously briefed around some of the interventions that we've carried out, and some of those in response to suggestions raised by elected members. The reconfiguration of the lights at Pole Park Road to reduce dwelling time there is one such thing. the change to the junction arrangements at Cleppington Road to reduce the amount of traffic queuing to do that east-west manoeuvre, I think has also impacted. I think members have rightly emphasised active travel, and there will be very considerable investment made by the council through funding from Scottish Government over the coming years. And one of the key arterials that we are focused on is, of course, the Lochie Road, and trying to work out what is the best route for that sustainable travel corridor. And I think that the final point, I think Councillor Macready again emphasised the importance of partnership. It will not just be us working on our own. And for example, Explore Dundee's decision to put their electric vehicles on the 28 route, which runs up and down Lochie Road, will deliver a significant improvement as well. So that is not by any means the only measures that we will be deploying, but there is a cohesive programme of action intended to help improve air quality on Lochie Road as a companion piece to the LEZ investment.
Thank you for that very helpful answer, Robin. Councillor Short.
Quite similar to Robin in that I've now had an opportunity to go on the number 28, which was incredible. And it is that thing about the widening of the buses being so much more better for the environment is huge. I'm still holding out for my storage on street for bikes so that I don't have to pull my bike up the stairs and have it banging about the hallway. However, quite interestingly, just last week, I also learned with my hat on for the Tay Road Bridge that Tatran are again having discussions with Fife Council with regards to a park and choose option on the other side. Because if the last 2 years have taught us anything, it is that a lot of the time it's not us as Dundonians and our citizens that are sometimes the problem, it's those coming into the city. So if we can basically park them outside before they come in, I think hopefully that will be a huge opportunity. And I just like to ask Mr. Stirling if there is an indication that some of the changes that have already happened, for example, like the change in the buses and the change in the 57, etc., have already had a bit of an impact. I know it's very difficult because it was only January that they came out, but and also we are a little bit in a frustrated situation with the fact that we've had 2 years of very little commuting. But can you give us a wee indication, please?
Yeah, I think Councillor Short's right. It's probably too early to get any meaningful data. But what we do know, though, and you know, the levels that we're seeing are still lower. The current, if you looked at we don't have the ratified data for 2021 yet, but indications are that year we were fully compliant everywhere, and in 2020 we were fully compliant everywhere. So that's one bit of good news, I suppose, out of the pandemic. But again, we can't claim that that's anything really too much to do with our own interventions. But it is the current situation. We'll probably have to wait a little bit longer to see if these changes that you referred to have made a significant difference. But we will keep monitoring.
Yeah, and convener, if you could just indulge me, and I promised I wasn't meant, but if we look back to the Dundee that I was brought up in, when you had the number 22 running down Reform Street and past Littlewoods, and cars running around the city square, and there you have Tom with not a car-free city square behind him, and Robin looks like he's at Albert Square, and the changes that we've made for places like the Murraygate and things, we've actually come quite far. And it's places like that other cities are now talking about. So I think we shouldn't forget how far we've come as well. And hopefully that little push will get us that bit further so that we can have such a wider space and start doing more things like Union Street, where actually people are paramount rather than the vehicles that get them there. So I can only applaud you for what you've done so far. I look forward to us taking it forward in a united council, because other places are dupping and weaving, but I think we've always been quite keen to move in the right direction. So thank you for keeping us involved, because it's been a bit of a long haul, but we're getting there now.
Well, thank you for that, Councillor Short. A long haul it has indeed been, and a lot of people have worked very hard to get us this far. So too many to mention, but thank you everyone for getting us here, and thank you for that positive end there, Councillor Short. So with that, is this report agreed? Thank you. That is the business.
Thank you, Convener. The next committee is the Neighbourhood Services Committee.
Thanks very much, Mr. Menny. Mr. Waddle.
Thank you, Convener. Firstly, are there any declarations of interest? Okay, there being no declarations, takes you on to item 2, coffee pods recycling. This item has been placed on the agenda at the request of Councillor Duncan.
So if Councillor Duncan would just like to speak to this item, please.
Thanks, Convener. I wonder if officers could maybe just circulate the motion I've sent to them. I mean, what I'm hoping is that it's a fairly brief and uncontroversial item concerning the recycling of coffee pods, a machine that I'm not fortunate enough to have myself, but I'm told they're quite good. The wee pods, my understanding is the wee pods, you know, once they've been used, consist of either plastic or aluminium. Both of these materials are obviously easily recycled. And I'm aware that, you know, elsewhere in the country, there are some local authorities who are trialling ways to help residents to recycle these coffee pods, including curbside collections. For example, you know, there might be one wee bin for the plastic ones and another wee container for the aluminium ones. But it's what the purpose of this motion is that, you know, Dundee's got not a bad record at all on recycling, and this is just a means of trying to help us to do a bit more recycling wise. And it was something that actually I'd like to claim that I dreamt up myself, but as I say, I don't have one of these machines. But prior to the pandemic, I did get 2 or 3 inquiries from members of the public saying that could the council explore ways of helping people to, you know, recycle these wee pods. Obviously, over the last 2 years, there wasn't a lot of chance to do anything about it. So I'm just thinking that now might be a time to ask officers to explore the possibilities of what is happening elsewhere, and to maybe consider what ways might work here in Dundee best for us. And it could be a range of, as I say, it could be curbside collections. It could also be drop-off points. I mean, I'm inclined to be entirely flexible about it, and to just see if we can make some progress on this. And to that end, you know, I don't really want to tie officers' hands on in terms of looking at any particular scheme or method, but really to just ask them, subject to committee approval, to go away, see what's being done elsewhere, and perhaps report back to us at some point on how Dundee might take this forward.
Okay, thanks very much, Councillor Duncan. I think we can all agree that anything we can do to increase recycling in any forum, and all its forums, should be explored. So on that basis, I'd be happy to support your item. I see that I've got Bailey McPherson wants to second you, and Councillor Dawson wants to comment. But if I could maybe just first bring in Tony Boyle, just for an officer view, if that's okay, Tony?
Yeah, sure.
Yeah, thanks, Convener. This is an area that local authorities are looking at just now, but the responsibility really lies with the manufacturers. There's going to be forthcoming producer and packaging regulations that place responsibilities on producers. There's a scheme known as PodPack, and that places that responsibility with those wider manufacturers, but they are beginning to speak to local authorities about possible solutions. So I'm happy to go away and look at the if it's a recommendation and approved by committee to look at this, that's put forward by Councillor Duncan.
Okay, thanks very much, Mr. Boyle. Councillor Dawson, do you want to come in with your comment first, and then I'll bring in Bailey McPherson to second?
it is just to actually support Craig in that. As Tony knows, I've been harking on at him for a while because I do own one of these coffee machines. I do like a posh coffee every now and again. And it's always annoyed me that you can't recycle them. But Tony's kind of covered what I was going to say, is that pod back is already there. And basically what you can do, depending on the machine that you own, you can just basically say to the people who make that machine and make the capsules that you want bags. They will then send you bags out free of charge, which you can then take back to, it's a Collect Plus, I think, which is in most local stores. And you can post it back to the manufacturer. Well, actually, it's a specialist recycling unit, I believe. Tony might correct me if I'm wrong, but and you can do that free of charge. I did one on Sunday, for example. So it is there, Craig, and I know I've been pushing Tony and the team to try and do something curbside as well, and I agree with you. But just to say that the options of pod back are already there. And I received actually more bags today to send my stuff back. But yeah, no, I agree with you. If we can do it, we can do it. But I suppose it all depends on the ultimate cost, if there is going to be any cost for us at the end of the day.
I think you're drinking too much coffee, Councillor Dawson, but anyway.
It's been said. It's been said.
You need decaf.
I think Councillor McCready wants to come in.
Yeah, I mean, just similar to what's already been said, I'm very happy to support this. I think, I think, as Mr. Boyle said, I think it's important that we do recognise that there is an onus on producers. You know, I think that we do need to look at, you know, all the items that we use and the people who produce them and how they go about producing things that are either easily recyclable or you know or they create a means where they can be recycled, which is, you know, I think that pod back system that Councillor Dawson showed that he's used and sent these pods back for recycling. So I think, yeah, I mean, really happy to look at whether there's an opportunity for the City Council to assist people in the city with the recycling of these, and also interested to find out more about what Mr. Boyle was saying. I think a very helpful contribution from Mr. Boyle to find out more about what Mr. Boyle was saying around you know, further developments in the industry to see whether there's other things that can be done to help that. But really happy to support the motion in front of us tonight. Thanks.
Okay, thanks very much. Billy McPherson, would you like to come in?
Thanks, Convener. I was simply going to be seconding Councillor Duncan, but there's a degree of consensus here, so I'm not sure that's entirely necessary. Very grateful to Mr. Boyle for his very helpful feedback. I'm aware of the pod back scheme, but certainly looking at all the possible options in relation to possibly curbside or neighbourhood drop-off, or what's viable and practical. It'd be very helpful if officers look at this. Anything that can be done to you know, further improve our recycling in the city should be welcome. So I'm grateful for all the positive comments regarding this. Thanks, Convener.
Okay, thanks very much. I'm not seeing any further comments. So with agreement to that, can we move on to the next item, Mr. Waddle?
Thanks, Convener. Takes you on to item 3, the contract for the treatment of mixed glass, and you have to agree the terms of the note.
So this is just, as it says, a contract for mixed glass, which we've had in the past. I know there was, you know, that there's obviously something coming along about the recycling of glass and deposit returns, etc., but that has been delayed. So we need to carry on with a contractor for the procurement of this material from April 2022. And we've had one contract bid to undertake the work, which is the same contractor. So a 1 year specified period, which will bring us an income of over 26,000. So that's not to be sniffed at. And we do have provision to extend the arrangement depending on what happens with the deposit recycling scheme. So any comments on that? Questions? No, not seeing anything. So with that, can that be agreed? Thank you. Mr. Waddle.
Thanks, Convener. Item 4 then is the vehicle compound at Riverside Composting Facility. You asked to agree to accept offer as recommended.
Again, it's fairly straightforward request. A new security fence to surround the vehicle compound at Riverside Composting Facility. Not seeing any questions, comments.
I have a question,
sorry, Billy McPherson, to see
no,
you.
No problem. It's not specifically, obviously, I don't think anyone will have any problem with what's been proposed tonight. In terms of capital improvements there, though, I've had exchanges in the past with officers regarding the composting facility and the complaints that have frankly gone on for years regarding smell caused by the work in relation to windrows and shredding. And in terms of capital improvements, I was very keen to see the council considering frankly the purchase of its own shredder rather than hiring in, because that takes the pressure off having to get shredding done over a particular time frame. And I was just really wondering if Mr. Boyle or one of his colleagues can give a very brief update on that particular situation.
Okay, Mr. Boyle, do you want to come in there?
Thanks, Convener. Yeah, I can confirm to Billy McPherson that is something we're actively looking at just now as part of our transformation proposals going forward.
That's appreciated. I think it would certainly help, and I'd be grateful to be kept updated. But I thank Mr. Boyle for that positive response.
Okay, thank you. Thanks for that. With that can be agreed. Not seeing any other questions. Thank you, Mr. Waddle. Thank you. Item 5 then is a report on environmental improvements, and you're asked to accept offers as recommended. So as you can see, some more environmental improvements, some at Camperdown. So lots of works there to improve the entrances basically, and pedestrian entrances and other entrances, and improve signage. And then another one at Meyer Kirk where the standing stones are, and that's more really to do with biodiversity and continuing our efforts there to improve and enhance the biodiversity of that space. And there's also going to be a new footpath, a new seating area. Anyone got any questions, comments? No. Okay, can that be agreed, please? Thank you. Mr. Waddle. Thanks. Item 6 then before the report, tenders received by Head of Design and Property. You'd asked to agree to accept offers as recommended. As you can see, some tenders there for window replacements and the communal stairwell at Kirk Street multi-storey developments. Fairly straightforward. Does anyone have anything want to ask on that? No. Okay, with that, can that be agreed, please? Thank you. And I think that is the business. Conveners, before we move on, the remaining items confidential, and the committee may wish to deal with that in the usual way. Everyone happy with that? Thank you. I think that is the business now. Thank you.
Thank you, Convener. The final committee this evening is the Policy and Resources Committee.
Good evening, everyone. We'll just move straight on with the business. Tracy.
Thank you. The first item on the agenda is declarations of interest. Does anybody have any declarations to make?
See no one reaching for their keyboard, so we'll take that as a no. Thank you.
That takes us on to item 2, which is the minute of the Community Asset Transfer Subcommittee from the 19th of January. This is submitted for information and record purposes.
Okay, we'll just go straight to the question. Billy McPherson.
I'm aware this is just for information, but I'd be grateful if officers could advise committee. I presume that the applicant, the unsuccessful applicant, has rights of appeal, and I'd really be grateful to know what the time frame for that is, what officers may be minded to do in relation to what is an important building in my ward at the Mitchell Street Centre. And I'm also conscious that away from the actual formal community asset transfer process, I believe there was another community organisation that had interest in the building, and I'd be grateful for just some detail. I'm not wanting the detail of or the naming of that particular organisation, but I'm just really wondering how officers are minded going forward. The last thing I want to see is this just being sold and turned into flats. If we can get a positive community use for Mitchell Street, I would very, very much like to see that, and I'd just be grateful for officers' reassurance in that regard.
Thanks for the question, Fraser. I think some of that is probably out with the reach of the item, given it's in relation to minutes of the subcommittee. But I'll ask David just to come in on a couple of points that you mentioned, specifically around timescales for appeals process, and then perhaps looking at Robin here, you can follow up after the meeting with some further detail that can be circulated and provide you hopefully with the reassurance that you're looking for. David.
Yeah, thanks, Convener. Yes, Billy McPherson, there is a right of appeal for the group who applied through the community asset transfer process, and that appeal runs out this week. So there's a couple of days still to go yet. There is only one organisation still engaged with the community asset transfer process. So I think it would be for Mr. Presswood to answer about what happens next in terms of the building, assuming there is no appeal.
Yeah, thanks, David. I think we're straying out with the agenda before us, so I'm going to ask Robin to perhaps follow that up after the meeting to make sure that we're sticking to the agenda in front of us. That's all right. I noticed
happy with that. I'm perfectly happy with that, Convener. Thanks.
Thank you very much, Fraser. I noticed that Will has intimated that perhaps the note of interest or declaration of interest should have been declared on this. So just for community services to highlight that in the chat function. Thank you very much. Are there any other questions on this item? Councillor Short, can I remind all councillors, including those of my own administration, to use the chat function rather than raised hands? I'll let you off, Lynn. Come in.
I think it's because I don't know whether I have to or I don't have to, so I can maybe take it off table with Roger and Robin as well. But
in
just
terms
to
of declaration, I presume.
Yeah.
Okay, no worries. Thank you very much. I see no other hands or questions, so can I take that item as agreed? Thanks. Okay, Tracy.
So item 3 is an agenda note on death grant appeals, and you're asked to approve the proposed amendment to delegated powers.
Again, hopefully self-explanatory. Any questions, comments on this item? No. Okay, we'll take silence as agreement. Thank you very much.
Item 4, recognition of NHS service. Again, your approval is requested.
Again, I think this is self-explanatory and a positive move from our perspective in recognising NHS service. Any questions, comments? No. Again, I'll take silence as agreement. Thank you. Tracy.
Item 5, community wellbeing centre update. This is for noting.
Thank you very much. Obviously, this agenda note details or provides an update to committee on the progress to develop a community wellbeing centre. And of course, it's disappointing that there has been a slight delay in the process for delivering that, but I think we're all agreed in terms of wanting to see that come to fruition as quickly as possible. And again, recognising some of the positive moves that have been made in recent months, and looking at some of the other services, in particular reference to, for example, the ambulance service, which I know Councillor Lynn has been very proactive in working with and celebrating, I think, the work that's underway there. But I will bring in Bailey McPherson first of all.
Thanks, Convener, and I share your disappointment about the opening date being pushed back from March to August, and we understand the reasons that's alluded to in the committee agenda note. My question really to officers is how confident they are that the August deadline will be met.
Sorry, Fraser, I was expecting more to the question there. That was very to the point, so thank you very much for that. If I can bring in, I think Diane is on the call. Yes, there you are, Diane. Can I bring you in, please?
Yes. Bailey McPherson, we're as confident as we are in terms of the information available to us at this particular point in time. You'll appreciate that part of this is around recruitment of staff to actually do building work, etc. But available information would indicate that hopefully will be the date that we'll be aiming for. But we'll certainly come back if there's any further delays to let people know.
Okay, we'll keep fingers and toes crossed then, Dan, but grateful for the response. Thank you.
Absolutely. I think it goes without saying that we'll keep elected members briefed on how that's progressing, over the next few months in particular as well. So thanks very much for your question. Councillor Lynn.
Hi there, thanks convener. Yeah, I think it's fair to say that I share Bailey McPherson's disappointment that we've had to push back the anticipated opening date. But as they say, every cloud has a silver lining, and in this case, I think the silver lining is that it gives more time for the stakeholder engagement group to continue with the work that they've been doing and developing the plans for the service and how it's going to operate. That stakeholder group's been meeting, I think, since before January. It says January in the report. Certainly they were formed in November, but I think they've been meeting since before the start of this year. And that stakeholder group is made up of people with lived experience of mental health issues, and also family members and carers of those who have experienced distress or mental ill health. And I think it's that I think is the silver lining, that they've got more time to continue with their work and make sure that the service that we have fits the needs of those who are likely to use it as closely as possible. And I'd like to thank those who sit on that stakeholder group for their participation and giving up their time. Although I know that I'm sure they do it willingly. I'd like nonetheless to thank them for what they're doing and the time they've given up to help us with the specification for the service. Thank you.
Thanks very much for your comments, Councillor Lynn. Certainly I agree with your comments there. I see no other comments or questions, so can I take this item as agreed? Thank you very much.
That takes us on to item 6, the joint inspection of services for children at risk of harm in Dundee City, findings and improvement plan. This report is for noting.
This is obviously an incredibly important document, and the report informs members about the findings of the joint inspection of services for children at risk of harm, which was published on the Care Inspector website on the 11th of January. And as well as noting the areas of strength and areas for improvement, which are summarised in the report, members are also asked to note the multi-agency approach to improvement planning that has been progressed since the inspection findings were notified, and the improvement plan approved by the Dundee Chief Officers Group as well, which will be submitted to the Care Inspectorate. And I think whilst there's much of note within the report, and even just turning to page 19 of the substantive report, the very first key message that says multi-agency preventative approaches helped children and their families receive tailored support at the right time, and this had prevented risks of harm from escalating for some children. It's clear to see that there is really important work going on, delivered by this fantastic team right across the city, and people are delivering support, again, as the report says, at the right time to those that need it. Of course, we can't be complacent. There is always room for improvement. There is always room for us to do more to protect young people and children in the city, and we've talked about that during some of the previous committees this evening. And so I will just bring in members for their questions and comments. So Councillor Cruikshank first.
Thank you, Convener. It's good to see that there was a close alignment between our position statement and the inspection team's findings. However, I did note that whilst we said that engagement with children and young people was a key achievement, the inspection report identified this as an area that requires further improvement. Are you assured that the Child Protection Committee has a good overview of current practice in this area, and that the improvement plan addresses all the points raised within the inspection report? However, it would be remiss of me not to mention the key facts breakdown presented in the joint inspection report, which paints a pretty grim picture of our city. Disproportionate deprivation affecting children and families all over Dundee. As was previously mentioned, the highest prevalence of domestic violence in Scotland, 166 per 100,000 versus 115 nationally. Twice the national average rate of child protection investigations, 29 per 1,000 versus 14 nationally, and the highest rate of child protection orders in the country, and so on. Only the re-registration rate, mercifully, is shown Dundee in a positive light compared to other local authorities. So even with the inspection giving Dundee a reasonable score, 4 out of 6, I'm sure that we can agree that we can do better. Sorry, lost my place. I hope that the identified areas for improvement will be pursued vigorously to ensure better outcomes for our young people. The commitment and dedication of staff has been rightly praised in these reports. It is now incumbent upon us to give them the resources they need to continue doing their good work for the benefit of vulnerable children and young people. And officers, page 51 to 58, officers have rightly identified several areas for improvement, both internally and prompted by the joint inspection. Lots of the improvement activities, and I'll forget that bit, and I'll go on to my final comment. Surely there needs to be a greater political commitment to giving these officers the funding and resources and the support they need to actually get the job done. Thank you, Convener.
Thanks very much for your comments, Councillor Cruikshank, and your questions as well. Just to go back to your first question, I think, which was directed at myself in terms of confidence in the staff and I suppose the ability to address the 4 particular areas for improvement identified within the inspection report. And I can say from my conversations with officers, and I know the opposition members likely have also had conversations with officers on the back of this report, and I've had experience as well. I think we've got a shared belief that our officers do a tremendous job in very difficult circumstances. They seek to address and support our young people and those families as they, as best they possibly can. Again, as I say, in very difficult circumstances. I'm also reassured with the detail that's before us in terms of that submission of the improvement plan, as I say, to address those fundamental issues. I think the other important thing to say is, in some regards, some of these areas were already being worked on as well. So much like the discussion that we've had previously, there are some areas where we know we want to do more and we want to do better. And this plan, or at least the assessment, I should say, provides us with the reassurance that in some of these areas we are in the right place in terms of looking at where our resources are deployed and how best to put them forward. I think the other thing I would say is that, I don't read in this report that there's a suggestion that our services are starved of cash, and I don't want that message to go out from committee, and I know you weren't suggesting that at all. But I think it's really important to say that there are significant resources that go into the protection of young people, protection of our children across the entire city. And we need to make sure that we recognise that the value of that resource is actually very important, but also the value of the individuals that are working within those services are vitally important as well. And cash doesn't always equal good outcomes, but having good people can have a really significant impact, and it's really important that we continue to work, improve the quality of our output from a staffing perspective, and also learn from best experience elsewhere. And I think officers give that commitment frequently as well. I'm conscious that there are officers on the call, so I would like to perhaps just invite officers, if there's any specific comment they wish to come in at this point. Excuse me while I look at my list. Audrey, can I invite you in the first instance, please?
Yeah, thank you. Happy to come in. I also thought that Glenn was still on the call, but I'm not sure if he's dropped off, so he may come back on, but I'll try and pick up some of that in the meantime. Convener, thank you, and thanks to Councillor Cruikshank for our comments and indeed our questions. So yes, I think that it was important to see the alignment between our own self-evaluation as we put it in, as it goes into a multi-agency inspection and scrutiny like this. We put that as our position statement, and when the team of inspectors from the different agencies came to visit with us in Dundee, albeit virtually, and spoke to many groups, they absolutely found the same as we had already identified as our strengths and our areas for improvement. So I think that in itself is a strength, to know yourself and to know where you should be directing your resources and absolutely prioritising. So that was very positive. And yeah, just to re-emphasise the point you made yourself, Convener, that a lot of that work was already underway. So the work that we've been doing with our young people services to reconfigure what we want to do for our adolescents. You know, as I know it's confusing, the older young people that were being referred to several times, but we've realigned our management structures and indeed looked after having an oversight group to support the work that needs to be more targeted for our teenagers, in particular that 16 to 18-year-old group, where we're seeing that transition, sometimes the challenge between children and adult services. So big focus there for us. We also picking up some of the comments around the other impacts, if you like, on young people around this area in terms of mental health, for example. We have just launched our Connected Tayside improvement plan for mental health and emotional well-being for young people. And already, without repeating what's been said already on the previous committee, you know, around the work of quality assurance, multi-agency quality assurance, and certainly having a real deep dive into outcomes and measures to evidence the work that we're doing and the improvements that we're making. And of course, as part of delivering our promise, getting the voice of young people and families central to their plans. So these are all areas that were already well underway, and pleased to say that the commitment of the teams that are working around this area is to continue to develop that. Now I see that Glyn's hand has come up, so he's obviously come back on, and so happy to stop there and see if you want to bring in Glyn Lloyd.
Thanks very much, Audrey. Glyn, do you want to come in?
Yeah, thank you, Convener, thank you, Audrey. And only to say two things, really, that both internally as a council and as a partnership, we're absolutely committed to build on and learn from what we've been doing over the past 2 years. And obviously, the pandemic has brought with it many, many challenges, but it's also brought a number of opportunities as well. And I think you can see in the report that many of the initiatives we've been progressing over the last 2 years has been a result of those opportunities. And just to come back as well to Councillor Cruikshank's question on engagement, we said we were strong in the self-assessment because we believe we are in relation to engagement with care experienced children and young people. And equally, we believe we are in relation to the workforce's engagement with families, which is mirrored in the findings of the report. But the comment really in the report related to engagement with children and people, specifically in formal child protection processes. So what we now need to do is extend that practice that we've already got in place in relation to care experienced children and people to children in formal child protection processes, whether they be part of an initial referral discussion or a child protection conference, or subsequently on a child protection register. We need to extend the same methods and principles to them, and that's exactly what we're doing. We have a new team, multidisciplinary setup, to do just that, and they're going to be extending a range of different engagement methods with different children and people dependent upon their age and their stage and their needs.
Thanks very much, Glyn. I mean, I was certainly reassured before the meeting in the conversations that I've had with officers, but I'm doubly reassured now, and I hope, Georgia, you're equally as reassured by those responses from officers as well.
Yes, thank you, Convener, for your comments, and from Audrey and Glyn. Much appreciated, but it doesn't stop there. Thank you.
Thanks very much. Bailey Wright.
Okay, thank you, Convener. Obviously, the inspection report clearly reflects very positively on the hard work and the dedication of our staff. Can I ask what has been done to acknowledge this and make sure that they're aware of the findings, and also to thank them for their hard work, because a lot of hard work has gone into that. I think the improvement plan that the CPC has developed looks very comprehensive, and it's good to see what work was already in process alongside some new actions that have been identified. But if I could ask the independent chair, do you feel that we have the right resources and also the right commitments in place across the agencies to be able to deliver this plan?
Thanks very much for your question. Elaine, can I bring you in, please?
Yeah, thank you very much. And thank you for the question. I think this is a really good report. And when you read the report, there are a lot of very, very positive messages for staff that I think we need to get out. You know, we're rated as good in terms of the quality indicator that's all about impact on children. And that's about the extent to which children and young people feel valued, loved, fulfilled, secure, feel listened to, understood, respected, and get a really good start in life. Now, that's got to be a positive. So I think we need to be picking up some of the positive messages out of this report and feeding them back to staff. And I know we're doing that. We've been talking about it at the Chief Officers Group. We've been pulling together a statement that we can get out to staff, a video that can be also shown to staff, just to say that, because if you read some of the statements in here and the sentences, there's some really good news here. And I know there's improvement areas that we need to make, and we need to concentrate on those too. But I think in terms of, you know, we've been 2 years through a pandemic, staff have had the nose to the grindstone. They've been really working hard. And I think this report has to be a positive for them. And you're right, we need to make the most of that, get the messages out. And I think the media should be also picking up on this as well, because I think there's some really good news. And one of the things that the inspectors did was they spoke to children and young people and families directly. They came into Dundee, and even though it's through the pandemic, they came and they met them face to face, and they got some very, very positive messages back from people who we were working with. And again, I think that needs to be commended and taken forward. So absolutely, key messages needing to go out. We're on the we're working on it. We're working on it on a multi-agency basis, and certainly I know the Chief Executive and others are behind this, along with myself, to get that word of thanks out to staff. So thank you for your question.
Thanks very much, Glenn.
Did you want to answer the question about the resources? Do you have the right resources? Although it's not a very popular question, but it's one that has to be asked.
I think the improvement plan that you've got in front of you does actually indicate the timescales for that, and also, well, we've still got a little bit further work to do just to firm all of that up, but also the resources that are required. We're working on, we're indicating the timescales, we're indicating who's got capacity to help us. Remember, this is a multi-agency plan. It's not just Dundee's council. It's broader than that. I think I know the Chief Exec knows that if I feel that we don't have the right resources as we follow this through, I will be coming and saying that and indicating that if we do need additional support, we'll be requesting that. But there's a lot of resources around, and I think if we use them wisely and we use them in a multi-agency basis, we should be able to take the majority of this work forward in a timely way, which is important for children and young people in Dundee.
Thanks, Elaine.
Thank you for that.
Thanks very much for the question, Bailey Wright, and thanks very much for the comprehensive response, Elaine. And I think you're absolutely right. There's a lot of positives here within the report, and you know, people who are involved in the delivery of the service should be very proud of the role they play in protecting young people and enhancing their lives. Because at the end of the day, this service is about outcomes, and hopefully positive outcomes in that regard as well. I'll bring in my colleague next, Councillor Hunter.
Yes, thank you, Convener. I just want to say, first of all, I don't have a question, it's just more a comment, and just talking about how I think this is a really important report. And I think we've heard from the answers to the two previous questions, and we also heard earlier on tonight in earlier committee some of the work that's been going on behind this, and I think that's really important to reflect on that. I think it's also important when we're reflecting to reflect about where we've come from, because this has been a significant improvement since the last time we were inspected, and I think that should be noted. That actually what this report is telling us is we have made some significant progress over the last few years, and I don't think we should go away tonight without recognising that. And the reason why that has happened has been the hard work of a lot of our staff and our partners who have helped deliver that progress. So I don't think tonight we should go away without recognising that progress that has been made over the last few years, because I certainly think in the past we've had some significant challenges with child protection, and I think what we're now seeing is progress. But as has been commented by other members tonight, that doesn't mean we shouldn't forget where we are as a city or forget where some of the challenges going forward are. And I think what this should be is a stepping stone to kind of build off this to make even more improvements, which will help benefit our young people, particularly those young people that we need to really look out for and support. So I think that's what this report is about and what we should be doing. And I think I've heard the comments about resources. And I think it should be absolutely clear that certainly I don't think the issue here is about resources. I think what we're trying to do is make sure that we deliver for our young people, and as a committee we're all committed to doing that. So this isn't about, do we need to find more resources? This is just about making sure that we build on this report and deliver for the young people, and where there's improvement plan in place, that we deliver that. And so I think that's really important. So I don't want people to go away from tonight thinking that this is anything but a positive report that has shown us a significant progress over the last few years, but also doesn't mean we don't have some challenges that we still have to face, and we're all committed to delivering that. I think that's a really important message we get out tonight.
Very much agree with you, and thanks very much for your comments. And I saw Elaine nodding throughout that as well. And I think the key word that you mentioned there was progress, and that's what we all want to see continue going forward as well. So thanks very much for your comments. I see no other contributions at this point, so can I thank you all for your questions and officers for the responses, and can I take this item as agreed? Thank you very much. Tracy.
That takes us on to item 7 on the agenda, mental health and well-being planning in light of the impact of COVID-19 on citizens of Dundee. Again, this report is for noting.
Yep, following on obviously from item 5, I think it's pertinent that we're also discussing the impact of COVID-19 on Dundonians. This report gives an overview of the current strategic planning on mental health and wellbeing as a result of the learning from the impact of the pandemic and how we've delivered services over that period of time. So some of the developments outlined include a refresh of local health and wellbeing networks, the production of a new community learning and development plan, which will also include a section on addressing health inequalities, and the formation of a new communities and inequalities workstream within the mental health and wellbeing strategic and commissioning group. So lots of work ongoing, and of course lots of learning, as is always the case. Are there any questions or comments on this report? No. Okay. Can I take silence as agreement? Thank you very much. Tracy.
Okay, item 8 is the Risk Management Annual Report, which is for noting and remitting for future reports.
Yep. Hopefully self-explanatory. I'll just open it up for any questions or comments. Bailey Keenan.
Yeah, Convener, we receive reports on establishment changes, and usually that highlights positions that have changed, promoted posts, or new people coming on, and often we're not seeing very much of them off late. But we're now seeing a risk coming up that suggests there's a risk in retaining staff. I think it's 86, page 86, and I'm just wondering whether officers could potentially give way an issue where there is, or perhaps add to that establishment change report and give us some details of the areas where they see there being a bit of pressure in retaining and recruiting staff. I know that, for instance, architectural services have been mentioned in the past, and when I look at some of the things that we're having to do in relation to replacing roofs, often a sort of £4 million cost, I really wondered whether we had the individuals that were there to guide us, and make sure that if there was a change to a specification, that it got its way filtered through the organisation. So we'll no prejudge that or the leisure centre's ultimate reports, but there are huge spends, and I would concern me if we didn't have the right people in posts in particular areas, and architectural service here is one. We've seen other things in the city where we're waiting on the houses being built at the top of the hill town, Derby Street, delay after delay. A lot of that around obviously being able to retain and keep staff. And, we've obviously got our own issues, and I've had them directly from health and social care when I've asked about care packages for individuals that have been in homes or in hospital, how we're getting them out, and it's been a real difficulty putting care packages together. So it would suggest to me in care, we've got a real issue in having the right number of staff to deliver the services. So I'm wondering if officers can come up with some way to make us aware of, as councillors, why we've got that risk there, and to the areas that show that biggest risk, so as that, you know, if we need to do something to address it, then we could best put resources or efforts into doing so.
Thanks, Bailey Keenan. I'll bring in the Chief Executive in just a moment, but just to say, I think it's important, as you rightly say, not to conflate or prejudge other things. And I think we're all aware that recruitment across the board, not necessarily just specific to one area, but recruitment across the board has been difficult as a result of pandemic. And that isn't particular, one, to Dundee City Council or two, to Dundee. I know from discussions amongst other organisations that they are equally finding it very difficult. And of course, within that, specialisms are often hard to recruit because there isn't always the movement of people as there once was. But Greg, can I bring you in at this point, please?
Yeah, thanks, Convener, and thanks, Bailey Keenan, for the question. Currently, the establishment change note process wouldn't accommodate the information which you're looking for because it's an automated system. Just to give elected members an assurance, there are over 30 vacancies currently being advertised on the council website. So officers are in no way stopping posts being vacant. But what we've seen, and I think what I've been asked previously, is since the pandemic, we're seeing people choosing not to potentially leave jobs, or the people that are leaving jobs are able to secure jobs out with Dundee and potentially further around Scotland because of the options around hybrid working. So what you'll begin to see when we're looking at advertising the council's posts is how do we make the council more attractive for people to want to stay, but also attracting people who want to come and live and work within the city. So there are things like we're extending the amount of time that jobs will be vacant. We are looking at the promotional material that goes with the jobs. We are looking at academies for areas where there are potential shortages that we're seeing, and we've got ongoing academies within social care. We are using our employability teams as best we can. We will be engaging with the universities. So I'm happy to pull that together in terms of a briefing note and run a briefing session with elected members that will outline the challenges that we're facing, the areas where we're seeing that challenge, and also what officers are doing to try to overcome that risk. And I think that's what's important. What the paper in front of you is highlighting a risk. What it's up to officers to do is demonstrate how we can mitigate that risk, how we can retain staff, and how we can recruit them. But just to emphasise what Councillor Alexander said, this is not a Dundee specific only challenge. This is something that's been replicated around a number of employers within the city, but also throughout the rest of Scotland, but one that we're trying to do what we can to overcome it. Thanks, Convener.
Thanks very much for coming in there, Greg. Bailey Keenan.
Convener, more than happy to accept what's been said. I realise it's not just a Dundee problem, but you know, when it comes to addressing issues, we are here to address the issues of Dundee and not address the issues for anyone else. I do appreciate the efforts that the Chief Executive is going through, but I would welcome that report that he's suggesting he'll bring forward, because I think that would give us all a better understanding than trying to look job ads to get a flavour for what are the real pressures in the council.
Okay, thank you very much for that. I see no other questions or comments on this, so can I take this report as agreed? Thank you very much. Tracy.
The next item is the Capital Expenditure Monitoring Report. You're asked to note the latest position regarding the capital plan and approve the recommendation for the additional expenditure.
Again, self-explanatory report. Any questions or comments on this? Nope, I can't see any. So can I take this as agreed, please? Thank you very much.
Okay, item 9, revenue monitoring. You have a report before you.
Again, the regular update on the revenue position. Bailey McPherson.
Thanks, Convener. I have a question in relation to the information on page 129, specifically bad debt provision, which reflects the projected increase in bad debts this year, which is very significant, some £850,000. And I was wondering if officers could give some background in relation to that and how they hope that we will have a lowering of the need for this level of bad debt provision going forward.
Okay, thanks very much. Bailey McPherson, I'm just trying to see which officers are on the call. I'm struggling with my teams this evening, so forgive me. Robert,
perhaps Robert Emmett can answer that.
Yeah.
Sorry, thank you, convener. So I suppose just a couple of points to make on that. We've actually done well in terms of collection of council tax and rates this year, so that collection is up, and I think a lot of the bad debt provision relates to the consequences coming through from COVID, where we've seen difficulty with businesses in terms of making payments. I don't have the details to hand of what makes up the change. Unless Paul Thompson can add something on the call this evening, convener, then we can circulate that information to members after the meeting, though.
And Paul, do you want to come in? I can't see you on my screen, but please come in. Paul, are you there?
You're on mute, Paul.
It's his microphone's not working.
Yeah,
he's not on mute.
Yeah,
right.
It's not mute. Could I just say, convener, because I'm conscious of time in any case, I'm perfectly happy that that Robert and Paul circulate something regarding this. If this is purely the outcome, the outcomes from COVID, which it hopefully will be a positive direction moving forward, but it would just be useful to get that level of reassurance, and I'm perfectly happy that we get an email update in due course.
Perfect. We'll make sure that happens. Thanks very much, Fraser. And I see no other questions in the chat function, so can I take this as agreed? Thank you very much. Tracy?
That takes us on to the final item on the agenda, which is an agenda note on the Fleming Trust. This refers back to the meeting of the City Council's Fleming Trustees earlier this evening. You are asked to agree to lend the requested £1 million to the Fleming Trust for the proposed acquisitions.
Thank you very much for that. Any questions, comments on this? No. Okay, can I take that as agreed? Okay, thank you very much. That is all the business. Thank you for your contributions, and we shall see you Thursday for the budget. Take care.
Thank you. Good night.
Thank you.
Right.